The event is about to start, so please find your seats. Good evening, ladies and gentlemen, and welcome to Power of Us. The event is about to start, so please find your seats. Good evening, ladies and gentlemen, and welcome to Power of Us. The event is about to start, so please find your seats. And now please rise for the national anthem, played tonight by Reverend Dr. Jesse McGuire. Please welcome tonight's MC, anchor, reporter, and sports director at CBS 58, Lance Allen.
Thank you very much. You may be seated. We even brought fireworks in. I don't know if you heard that, Jesse, as you were playing, that we had a little bit of fireworks outside the stadium. So that was a big thing for all of us this evening. Welcome to the Sina Magowitz Foundation's 2025 Power of Us celebration. I'm Lance Allen. It's an honor to once again be your MC, to be welcome back this evening. We're thrilled to have so many survivors, caregivers, advocates, doctors, donors here on the field with us tonight, and we have an incredible night in store for you all. We would also like to thank the Brewers for this evening. One, for the permission to use the field and have dinner on the Daimond, and two, to conveniently be in Cincinnati as the Red Hot Brewers are going for 14 in a row against the Reds. So give that a round of applause this evening as well. And let's just say my one bad joke of the evening is if you start looking at your phones because they just started playing, I'm not going to get offended. Let's make sure we stick to the message this evening. It's kind of like with my kids. They're always looking at their phones at the table. So if you look at your phones for a score update, I'm not going to get offended, but try to stay focused on the evening. I know it's hard to do. What a powerful way to kick things off. Once again, let's thank Jesse for that moving performance of our national anthem right over there. Awesome job. Jesse is so talented. He's from Phoenix, Arizona. He's performed at every major Sina Magowitz Foundation fundraiser since 2002, making him a true partner in the mission. Now to officially open tonight's program, we'd like to have Dan Winkleman join us on stage for a prayer. He is a 6-year survivor, an incredible story. It's one you'll want to hear more later tonight. In the meantime, please join me in welcoming Dan Winkleman to lead us all in prayer. And Dan, I hope you don't get blown away. There's a wind coming up here on the stage or whatever, so hang tight, my friend.
Yeah, I think that is the wind of the presence of God. So let's just pray. Amen. I love that. Amen. So, Father God, I am so grateful to have this opportunity to invite you into this place, because I believe that you are who you say you are, even though we don't all understand that in the same way tonight. But I believe that you are that great God that does great things, and that you not only have done great things, that you will continue to do great things, and you will do great things here tonight in this place. I've also come to know you as the God of all hope. We all need that. especially those who are here tonight. We need to have your hope poured out for us. And so I'm asked specifically that you would bring hope to the hopeless, that you bring help to those who are in need, and specifically that you would bring healing tonight to those who are struggling against this terrible disease of pancreas cancer. So in closing, Father God, I ask you to bless this night tonight. Please be with us. Do great things tonight. Bring all the hope that you can bring in this place. We thank you now for the food that you have provided. We are grateful and we give you thanks for what is about to take place in this place tonight. In Christ's name I pray, amen.
Thank you, Dan. Now it's my honor to introduce someone without whom none of this would happen tonight and none of us would be here tonight, Roger Magowitz. And I saw him right away, instantly. Give him a round of applause. Smile on his face, always positive, always ready for this. Roger established the foundation in 2001 after his mother, Sina, received a pancreatic cancer diagnosis and passed shortly after. Rather than let his grief get the best of him, Roger resolved to take action, and that's what he did, to fight back against the disease that has taken far too many lives already. And while he's done that in the years since, Roger does far more than just run a foundation. No one rallies support quite like Roger. He also answers a constant stream of calls from patients, caregivers, connecting them with doctors, clinical trials, other resources that they may not even known were available. But beyond that, he also listens, he comforts, he ensures that no one faces this disease alone. And Roger, you will be happy to know this evening I have worn absolutely as much purple as I possibly could wear tonight. The tie, the shirt, I don't know if you can see the socks, even the socks have purple in them. We won't go to underwear and under things and stuff like that, but I've worn a lot of purple this evening and not be a Rockies fan or a Vikings fan or anything like that. We're here for the fight against pancreatic cancer. Please join me in giving a warm welcome to one of the most relentless advocates most of us will ever meet, Roger Magowitz. Roger, come on up.
Okay, you're going to make me cry, so sit down. Good evening, everyone, and welcome. I never get tired of standing up here and seeing the room filled with so many like-minded people who care so deeply about our mission. Before I go any further, I want to say a quick hello to four very special people. First, my beautiful wife, Jeannie, and my three grandchildren watching this in Hawaii, Emma, Caden, and Blake. When I look around this room, I see more than just faces. I see patients who give every day everything they've got. I see families, loved ones, and caregivers who show up time and time again. I see doctors, researchers, advocates, and donors, all of whom share the belief that progress isn't just possible, it's already well underway. Tonight, it's an honor to announce that we have well over 100 patients in this room. That's the largest number we've ever welcomed at a Power of Us event, and possibly the single largest gathering of living folks with pancreatic cancer. This is extraordinary. If you are one of those patients, please stand up and allow us to give you a round of applause. This evening is about all of you and the journey many of you are on together. For some of you, it's a journey that began with a diagnosis For others, it's one that started with the diagnosis or loss of a loved one. And for others yet, it's about answering a single, simple question. If not me, then who? It's the same question I asked myself almost 25 years ago when I lost my mother, Sina, to pancreatic cancer. And it's a question many of you have asked yourself too. Yet your presence here tonight means you didn't wait around for someone else to step up, because we're building real momentum and giving people living with pancreatic cancer what they didn't have 25 years ago: options, time, and hope. And hope is not just a buzzword. It's something we find in every clinical trial we fund, every patient we connect with a world-class team, and every test and treatment option we help bring within reach. Hope isn't just about wishful thinking. It's about treating each patient as a unique case and about listening, adapting, and pushing beyond the boundaries of what's possible. Later this evening, you'll hear more about how we're reshaping the future of pancreatic cancer by changing the standard of care, the patient experience, and ultimately, the trajectory of lives. That's the kind of progress you all make possible, and it's the kind of progress we're paving for here tonight. With that, let's get the program going. Lance, come on back out. Have a great evening.
All right. Thank you once again, Roger. Please note we have several Rogers who will be taking the stage tonight, so you may hear us refer to them by both first and last names so you know who's who on your scorecard out there. All right. Next, I want to take a moment to acknowledge our major sponsors, many of whom who have been by our side since day one, and this would not be possible without them. So please support these sponsors, listen to the words that I have to say, and please go out of your way to thank them for this evening. Special thanks go out to Mark Adanazio, the owner of the Milwaukee Brewers, his team, the staff, Roger Kaplinger for allowing us to have this event at the beautiful ballpark tonight. Give them a round of applause. We also have Gary Powers and Andy Winkleman of Ortho Molecular Products, the entire Winkleman family, for assisting Dan Winkleman with his Hope on the Road fundraising campaign, where he rode almost 5,000 miles from Milwaukee to Alaska. Give that a round of applause as well. Absolutely incredible achievement. We have the Moran Family Foundation. We also have Customatic Sleep Technologies, April and Ashley Roses, the Isaac Corporation, Rule 2 Advisors, Gary Fazio, Carl and Kathy Glassman, Sue Chase, Morley Companies, and Serta Simmons Bedding. Give them a round of applause as well for their support. And of course, your generosity does more than fund research. It fuels progress, expanding treatment options, increasing survival rates, pushing us closer to the goal of making pancreatic cancer a chronic and treatable disease. That kind of progress does not happen on its own, though, my friends. Instead, it takes people who use their voice to move needles and make a difference. And one of those people is my friend Roger Kaplinger. His efforts, his openness, his advocacy have paved the way for advancements both within the pancreatic cancer community here in Wisconsin and beyond. Roger was the medical director for the Milwaukee Brewers for 33 years, and since he's retired, he didn't step back after his own 2017 pancreatic cancer diagnosis. Instead, he stepped up. With the help of Brewers owner Mark Adanazio and the entire Brewers organization, he's played a key part in raising awareness, raising funds, and opening doors to new treatment options that are helping people lead longer, healthier, and more fulfilling lives. He and his wife Jackie have become proud supporters of Kathy's House, a nonprofit guest house that provides low-cost housing and a home away from home to out-of-towners receiving treatment for serious illnesses and their caregivers. The family has also given back through other awareness and fundraising efforts. And speaking of giving back, if you have yet to grab an auction paddle, please do so, and you are ready for tonight's live auction later tonight. That is always one of the highlights of the evening. Every dollar raised directly supports critical research, moving us much closer to developing early detection methods, expanding treatment options, improving patient outcomes, and ultimately making pancreatic cancer a chronic, treatable disease. And I kid because I care. Roger is a good friend. A lot of people think me working in television, all I do is sit in a tanning bed or play golf all the time, so that's why I have a beautiful tan. Roger's tan is much better than mine, all right? So maybe afterward you'll want to ask him about that as well. So please put your hands together for a true advocacy in every sense of the word, Roger Kaplinger.
Of all the things that I've done, this has always been number one, baseball. The commercials, the films, the television series. I could never wait for everything to get over to get back to baseball.
Self-deprecating, brilliant, funny.
He's one of a kind. There'll never be another like him.
Anybody who was around him was lucky to be around him. You likely learned something, and you for sure got a good laugh.
Uecker spent more than 5 decades as the radio voice of the Milwaukee Brewers.
He played 12 seasons of professional baseball, and that'll be like the 8th thing that people remember about him.
There's no comp for him.
What a life. What a baseball life that Bob Uecker lived. He broadcast for the same team for 54 years. He starred in his own sitcom. He played one of the most iconic characters in any baseball movie ever, right? Harry Doyle.
His first offering, just a bit outside. He tried the corner and...
No, I was born in Milwaukee and grew up here.
Oh, okay.
I really did.
As
yeah,
I said
I was born in the city, and I don't know why that ever came about, Jim. That a lot of people didn't think I was born in the city of Milwaukee.
Hey, it's a pleasure to buy a beer for a great pitcher like Whitey Ford. Hey, Whitey, I thought you were a lefty. Oh, that's right.
You know, one of the best things about being an ex-big leaguer is getting freebies to the game. Call the front office, bingo. And once these fans recognize me, I probably won't even have to pay for my light beer from Miller. I love them. These fans know I drink light because it's less filling and it tastes great. Good seats, huh? You're in the wrong seat, buddy. Come on. Oh, I must be in the front row.
He was always on, and he said, it's not like I have to turn it on and off, it's just who I am.
He was completely authentic. He was himself on an afternoon game on Wednesday in the Brewer booth, and he was himself when he was with Johnny Carson.
Okay, Mr. Baseball is with us. Hey. Mr. Baseball, Bob Uecker.
No, this is actually a picture of me getting ready for a game.
Were you injured like a lot of ball players? They always seem to retire because of injuries. The elbow goes, or...
I think for me it was more my hands than anything else. You go in a bar after a ball game and you're sitting there 3-4 hours popping a few, and sooner or later somebody's going to step on your hands, you know?
Hello, Bob. This is President Reagan calling from the White House.
What he did for the game is incalculable.
Yeah.
So we must honor him.
A genuine baseball treasure, Bob Uecker. Mr. Baseball, the one and only.
That's our buddy Uke. I first like to thank Big Roger Magowitz. So whenever we get on conference calls and Zoom calls, someone says Roger and we both answer. So now we have Big Roger, Little Roger. I also want to thank Mr. Seelig, the former commissioner of baseball, our owner. If we didn't have this roof, we would all be getting rained on right now. So I just want to thank him for that. And on behalf of the Sina Magowitz Foundation, Freighter and the Medical College, my family, myself, thank you for attending the Power of Us and the dinner on the Daimond. This supports pancreatic cancer and pancreatic cancer research. Your presence, your generosity, your commitment to this important cause made this event truly meaningful for everyone in our community. Together, we are advancing research, raising awareness, offering hope to those affected by pancreatic cancer. Your support brings us one step closer to breakthroughs that can save lives. We are deeply grateful for your participation, your compassion. Thank you for standing with us to fight this disease. As you saw that great video clip, I'd like to take a moment to reflect on my dearest friend, Bob Uecker. Ueck passed away with us in January of 2025. What an incredible life Ueck had. From baseball to movies, TV, commercials, this man did it all, and I will tell you, often without a script. He made his own shit up. He did. He sat right here at this event last year, supporting us, lending his strength, lending his spirit, and his support for this foundation in our pancreatic cancer community. His presence that day was just more than a gesture. It was a legacy of compassion and commitment that we can move forward today. As you look around this magnificent ballpark, the impact that Ueck had here in Milwaukee and around the world, this is his home away from home. This was his sanctuary, which he was the consummate professional. He was a radio broadcaster for over 5 decades, an MLB Hall of Fame broadcaster, and I may add, he should have got in as a player. His one thing, as you saw in that speech, that stood out, that baseball was always number one. Baseball has given us Bob Uecker as a friend and a humanitarian. As I said, he hit a lot of homers. He hit homers off the greatest pitchers in baseball history, Sandy Koufax, Gaylord Perry, Fergie Jenkins, just to name a few. But Ueck was a big leaguer in every sense of the word. With that said, he had some personal pancreatic issues. He did not have pancreatic cancer, but on an incidental finding, we saw some masses on his pancreas. Those were determined precancerous, and so that it necessitated the removal by our good friend Doug Evans. In addition to that, we all know that family history is very important in pancreatic cancer research and the diagnosis of that. And Ueck's mother, Mary, passed away of pancreatic cancer. So often in a world driven by self-interest, there are rare individuals whose generosity transcends personal gain. We remember and we honor Ueck, who gave himself so that other people may benefit. He turned compassion into action and sacrifice into hope. His selfless contribution was just not an act, but a legacy, one that now fuels clinical research, supports patients and families, and brings us closer to breakthroughs in the fight against pancreatic cancer. Because of his generosity, others will live longer, live deeper, and never walk alone. His impact was profound. His memory will never be forgotten and be an inspiration for those he touched. He was a great friend, but more, he was a guiding light, a quiet hero, a man who lived defined by his generosity, and in every conversation he listened wholeheartedly. In every challenge he met adversity with strength and grace. In every act he thought not of himself, but how others might someone else be helped. He gave his energy, his resources, so others may have a chance, a little more hope, and one more with the ones they loved. His support of pancreatic cancer research was more than just a cause to him, it was a mission. He gave himself with unwavering conviction, believed deeply in the future where he lived, that we save lives and help families spared the pain of loss. His generosity wasn't just measured of what he gave, but the hope he inspired lives that he touched. Through the Bob Uecker Chair for Pancreatic Cancer Research and the unwavering support of Dr. Bill Hall, we are forging new pathways in the fight against pancreatic cancer in one of the most deadliest forms of this disease. This partnership embodies the power of dedication, innovation, and compassion. Dr. Hall's tireless commitment and visionary leadership not only driving the cutting edge of research, but also bring real hope to patients and their families. With the generous support of donors and the legacy of figures like Ueck, we are not just funding science, we are fueling life-saving breakthroughs. Together, we are providing the progress that is possible and the hope that is stronger than cancer. Though Uke is no longer with us, his spirit continues in every breakthrough, every life that is extended, every person who walks forward because of the path he helped us pave. We remember not only as a dear friend, but a man who chose to live with purpose, to give with an open heart, and show us all what it means to make a difference. He will be missed more than words can ever say. As we say around the ballpark, it takes a village to take care of Uke. So to his family, Judy, Sue, Kathy, Bobby, thank you for sharing Uke with us. To my Brewers family, you are very special. I've lived here my whole adult life in this ballpark, and they have given me this platform to make a difference and to pay it forward. But lastly, certainly not least, my wife, Jackie. Thank you. You are the rock of our family. You hold us all together. In closing, it's clear that you touch more than all of us could ever hope, usually with a joke. Thank you. A story, or remembering that being in the front row doesn't always mean you're in the game. He once said, I led the league in go get 'em next time. Well, thanks to his incredible generosity, there will be a next time. For researchers chasing a cure, for families chasing hope, and for patients who need one breakthrough. Through the Bob Uecker Chair for Pancreatic Cancer Research, with the brilliant leadership of Dr. William Hall, Uke's legacy will continue. Not just a Hall of Fame broadcaster, a baseball legend, but as a man who showed us that humor and heart go hand in hand. And if he was here right now, which I think he is, I bet he'd tell us, I'm happy they just spelled my name right on the plaque. Thank you to Uke. Thank you for keeping all of us keep swinging. And until we meet again, my dear friend, I love you. It is my distinct honor and privilege to introduce Dr. Bill Hall, a respected leader in the field of radiation oncology, a dedicated physician at the Freighter and the Medical College of Wisconsin. Dr. Hall has built a distinguished reputation, not only as a highly skilled clinician, but also a pioneer in advancing research and innovation in pancreatic cancer. Mostly in recognition of his outstanding contributions, Dr. Hall, this past year, was awarded the prestigious Bob Uecker Chair for Pancreatic Cancer Research that was attended by Uke, Judy, Bob, everyone from the Uecker family. The celebration took place in September, and it was a well-deserved testament to his dedication, his expertise, and his lasting impact. We are deeply grateful for Dr. Hall. He's with us this evening with his wife, Jane, and for the vital role he continues to play in shaping the future and care of the discovery of pancreatic cancer research. Please join me in welcoming Dr. Bill Hall.
Wow, that's going to be a hard act to follow. That was an incredible testament to Uke, and I'm really honored to be even here or peripherally associated with this. So first, I just wanted to say thanks for the opportunity to speak to you tonight. Thank you all so much for coming to this event. I feel really lucky to be associated with the Uecker name. You all could have done anything tonight, but you chose to spend your time at an incredibly important event that's going to raise money for a cancer that really needs dramatic innovation. I just want to say thank you to Roger Kaplinger. I mean, you talk about a man of action. The things that you have done to advance pancreatic cancer research and benefit our program are truly incredible. Roger, I can't thank you enough. Can we give Roger a round of applause? That's really both Rogers as well. But I also want to say thank you to the Uecker family. I only got to know Bob Uecker for a short period of time, but what an amazing man he was, and I can see that live on through his family, and it's really been a privilege to be associated with this award. Tragically, tomorrow, someone's going to wake up. Their skin or eyes may be yellow, They're going to go to the doctor's office and their whole life is going to be changed. All the plans that they had, all the things that they wanted to do, all the goals that they've been working so hard to achieve are going to be immediately called into question. Those patients come into a cancer center, meet with the team of oncologists, and they expect a cure. Our motivation as oncologists is to meet that expectation. We need to put their lives back on track. And it's that reality that drives me, as well as all of our amazing team members at Froedtert and the Medical College of Wisconsin Laban Pancreatic Cancer Center, to understand how can we improve outcomes and generate a cure for all patients with pancreatic cancer. And so while I've been treating, studying, researching pancreatic cancer for a while, not nearly as long as my amazing mentors that are here tonight, Dr. Beth Erickson and Dr. Doug Evans, just to name a few, I've been working on this cancer now for close to 15 years. And I am here to say that never in my life have I been more excited about what the future of pancreatic cancer research is going to hold. We are entering into an incredible era. Artificial intelligence is going to accelerate so much of what we can do in medical research. We have never before seen the ability to process, analyze, interpret data with artificial intelligence like we're seeing today. It is truly astonishing, and it's moving so fast at a rate that we're barely able to keep up with. And on one hand, it's a little intimidating, but on the other hand, it's incredibly inspiring, especially as you face a malignancy like pancreatic cancer, in which so many patients are not fortunate enough to be cured. I am convinced in my career we will have a cure for the vast majority of patients with pancreatic cancer. And for the first time, let's give that an applause. For the first time, I think we are genuinely seeing multiple pathways that will enable us to achieve that. Artificial intelligence is associated with novel ways of interpreting, analyzing, and applying translational data that's going to break down barriers in this malignancy in a way that we've never seen before. It's going to take time. It's going to take funding. It's going to take people like you. And it's going to take hard work of a lot of different types of scientists. But the good news is that we have each of those elements. We have the individuals willing to put in the hard work, and now all we need is a little bit of time to make these profound discoveries. Without organizations like this, without the Sina Magowitz Foundation, we would never be able to even get started on the pathways that are going to lead to innovation, discovery, and ultimately a cure for the majority of patients with this devastating malignancy. Without people that generously contribute, such as Bob Uecker, people like me would be slowed down considerably from innovating and discovering. Fortunately, it's people like Bob Uecker, the Uecker family, and people like you that take the brakes off of medical research and innovation and enable life-changing discoveries. I always like to highlight to donors and people that come out and contribute their time and resources to amazing causes like this, the value of these sorts of initiatives to clinical researchers like myself who are facing the barriers and challenges associated with innovation. Funding is everything. So from the bottom of my heart, and for the next patient that wakes up devastated and comes into our clinics with the expectation of us putting their lives back on track, I just want to say thank you. Thank you for bringing us one step closer to meeting those patients' expectations. Thank you for helping us put an end to pancreatic cancer. In my career, we are going to cure pancreatic cancer. It's coming, and I can't wait to share it with you all as it arrives. So in conclusion, thank you all for coming. And I just want to give a brief shout out to my wife who's with me today, Jane Hall. I could not do anything without her incredible support, and all of the things that I'm able to do, it's really because of her. So thank you all so much, and thank you for everything that you've done, and let's have a wonderful evening.
Yes, about 20 seconds. How would you like people to remember Bob Uecker?
You know, as a guy that had a good time and enjoyed people. I enjoy people, you know, I really do. I love this area. I love Wisconsin. I love Milwaukee. And, you know, someday I'm going to take a dive, and maybe it'll be in the broadcast booth, and they roll me down the screen here and onto a wagon and out the warning track, out the right field gate. See you later.
The arm is back. Here he comes. 1-2. Swing and a miss. Goodbye, Detroit. Swing and a bouncer. Double play ball. JJ second. Relay. Double play. Swinging and a fly ball in the center. Back. Warning track. Leaping, and he got it. Morgan a smash up the middle. Base hit to center. Here comes Gomez. Around third. A throw, and the Brewers win. Here it is. Swing and a drive to center and deep. Way back. Get up. Get up. Get out of here and gone. Get up. Get out of here. Gone. Left center and deep. Get up. Get out of here. Gone. Yelich sends one to right center and deep. Get up. Get up. Get out of here and gone for Yelich. No doubt about that one. And the Brewers.
How great is it to hear Bob's voice? I know he was here last year, as Roger mentioned, and just how much he would love what's happening this season, and how much he loved this city, and how much he loved this team. Dr. Hall, thank you for those encouraging words. Did you hear that? Close to a cure in his lifetime, in a lot of our lifetimes, and amazing progress, and a door could be opened very soon to beat this disease. Give that a round of applause. That is absolutely awesome news, and why we are here this evening. All right, I am smart enough to realize that I'm in between you and dinner, and I don't want to get in between that. So we're going to take a quick break. We're going to try to stay on time as well. We are very, very close to on time, and I'm partially responsible for that. So we're going to stay on time, enjoy the food and company. But a quick reminder, the raffle closes in 15 minutes after dinner, so please don't miss it. Use the QR code on the back of your booklet and look for the folks with the raffle tickets. They have those signs, so you can get your tickets now before time runs out. Winners can collect their raffle items upstairs at the registration table on the way out of the stadium. So we're just going to take a quick break for dinner. Enjoy your meals, and we'll be back with you in just a couple of minutes. Thank you very much.
Your smile, our memories I'll treasure forever. So try thinking with your heart. We'll be together again. Times when I know you'll be lonesome. Times when I know you'll be sad. Don't let temptation surround you. Don't let the blues make you bad. Someday, some way, we both have a lifetime before us. For parting is not goodbye. We'll be together again. Times when I know you'll be lonesome. Times when I know you'll be sad. Don't let temptation surround you. Don't let the blues make you bad. Someday, some way, we both have a lifetime before us. For parting is not goodbye. We together again.
All right, I know a lot of you are finishing up dinner, but we want to be respectful of your time this evening, and we appreciate you devoting your evening to us for this worthy cause. So thank you very much for that. Please give the wait staff and all of the people who prepared the meal tonight and just set everything up a round of applause. Absolutely incredible evening. The people, the tech people as well, that give me a microphone so you can hear me half the night, ad nauseum, whatever. Maybe they want to cut the mic, who knows. But all the people behind the scenes are here early, they're here late, and this is always a very special event, one of the highlights of the events that I do during the year. So I'm always appreciative of that and appreciative of the Brewers and everybody else for making this thing happen. So absolutely great night. We want to take a moment to recognize someone who took on an incredible challenge to raise awareness and support for pancreatic cancer research. We mentioned this earlier tonight, but I don't think we can talk about it enough because it is absolutely mind-blowing. 6-year survivor Dan Winkleman launched Hope on the Road, a campaign that combined his passion for motorcycles with his determination to make a difference. He rode 5,000 miles on a journey from Milwaukee, Wisconsin to Anchorage, Alaska, all while meeting people, sharing his story, raising funds and awareness along the way. And maybe, just maybe, Dan, you'll share stories about how you got saddle sores and whatever else was going on during this whole time, because I can only imagine riding 5,000 miles on a motorcycle, but absolutely incredible achievement. Here's a short video to give you some background on Hope on the Road and the incredible impact it's already made.
Man is gearing up for the trip of a lifetime. He's riding out west to raise money and awareness for pancreatic cancer research.
Dan Winkleman is just an incredible force, and his passion and his excitement is contagious. And I'll have you know that when we first met, his attitude was just as powerful and positive as it is today.
They're calling it Hope on the Road. They'll record their progress along the way and post to social media.
There's always hope. There's always hope. It's not a death sentence anymore. So riding to Alaska is a big thing for me. We're going all the way because we want to see 1.2 million come in to fund that clinical trial that's going to make it possible for somebody else to hold their grandson, to love their families. And, you know, we can come together on that. Thank you so much for being here.
I've never been to the Black Hills. It's absolutely gorgeous. The further west you get, the sky feels bigger. And, you know, in a way, it points to something bigger. One thing that my mind is drawn to is just the nature of what we're trying to do here, and thinking about pancreatic cancer as a very significant challenge, as a disease and as a cancer. I'm just really grateful to be able to take this journey. I'm very grateful for it, and I'm humbled, actually.
What do you think? Pretty awesome. Once in a lifetime.
I'm feeling pretty good at this point. When I'm riding on those long stretches, I'm thinking about the success of this journey and what the outcome will be. I get hope when I cross so many paths with people who either have a loved one who has passed from pancreas cancer or who are actually now in treatment. And so as I talk to these people all along the road, it gives me hope that awareness is going to bring about a collective of people who are going to work together to, you know, move the needle forward on the outcomes of pancreas cancer, and much like Sina Magowitz Foundation is doing.
This is a very special day. Pancreatic cancer, as you know, is a devastating disease. And so when we see a Dan Winkleman, this really is a beautiful thing.
Well, I
very excited about being at the finish line. Hope is actually a feeling of expectation along with desire that a certain thing or things will happen. And that is that we would raise awareness for pancreas cancer. After 20 days on the motorcycle and 5,000 miles, I believe it made a difference. So thank you to all who have made this ride, Hope on the Road, possible.
Andy, I see you out there. I'm glad you got that life-changing experience in the Black Hills area. It is absolutely awesome with your dad. Dan, come on up. Say a few words. Speaking of inspirational and life-changing, Dan Winkleman, ladies and gentlemen.
Well, good evening, everyone. Well, it's definitely been a ride, that's for sure. 6 years ago, I didn't even know if I was going to make another summer, let alone ride 5,000 miles on a motorcycle to raise awareness and funds for pancreas cancer. As you've seen in the video, Hope on the Road took me from Milwaukee, Wisconsin, where I received treatment. Thank you, Medical College of Wisconsin and Frederick Hospital, but where I received treatment all the way to Anchorage, where I used to once call home. And while I may have been alone on that motorcycle, it was anything but a solo ride. There was definitely a collective effort to make it happen. So many people played a part, and for that I'm so thankful. Specifically, I couldn't have done this without my son Andy and my beautiful granddaughter Faith, who followed me just in case I fell over or something like that. But without that, and also Andy's employer, Orthomolecular Products, my medical team at Medical College of Wisconsin, Frederick Hospital. Thank you, Dr. Doug Evans, for helping me do this. Next year, you get to go along. Maybe we'll get a sidecar or something like that. What do you think, folks? Huh? Dr. Doug in a sidecar going to Alaska? Maybe not. All right. Well, as a result, and with the help of many, we were able to raise, I think, a little bit over $440,000 to support the cause of pancreas cancer research. And I just have to give a shout out to Stan Vitkus because, you know, about 2 years ago, while I was still working and not retired yet, I thought, well, I'm going to try to raise a few funds too, kind of like you did. Well, it didn't work out the best for me that way. And then so I just said, okay, so what can I do now that I'm not working anymore? And one morning I had this idea that maybe I should just ride a motorcycle to Alaska with this guy called Fuzzy Biker, and then we'll see if we can raise some money. So I shared it with Roger and the Sina Magowitz organization, and they go, absolutely, we are on board with this. Here we go. Well, the next 7 nights I had terror sweats because I had committed to this absolutely insane idea. But anyway, we're thankful to everybody and, of course, to God for helping us to achieve this. And while the road is still long and it is unpredictable, but we've heard some absolutely amazing, hopeful things here already tonight, together, we have the power to change all of this. I do believe that. We have the power to change where all of this leads, to bring better outcomes for those who are diagnosed with this deadly disease. And so with that said, I would now like to invite, obviously, Roger, would you please come? Roger Magowitz and Elisa Thorstenson, Alina Hicks, my son Andy and his family, please come. Sandy, would you come? My wife Sandy, please come up on the stage with us, all of you. And also, Gary Powers, would you come and your wife Patty and join me on the stage here? I think they're going to do something like a check. Maybe. You got the check? I don't know. Did you get the money, Roger? I know that there was some issue with the check. I guess we got one. But I guess this is a moment that I have looked forward to from when I finally got out of the night sweats and terrors. I thought, well, maybe this will work. And here we are tonight. And so thank you so much, Roger.
so amazing. I'm Lisa. Congratulations. You did such amazing work. Oh my gosh. This way, since we're over here.
All right, Roger, you're on. I'm off.
We'll go this way.
Oh, we'll go out this way.
Yeah, this way.
All right, one more round of applause for Dan, his family, Roger, and everyone else. Incredible, $435,000. That is amazing. Thank you, thank you, thank you so much, one and all, for your generosity. Quick update, because you guys have been so good tonight. Very few of you are on your phones, other than my friend Tyler over here, and that's part of his job. He's got to look at his phone. The Brewers were up 1-0. It's now 2-1. They're down in the bottom of the sixth. So if you give more and you're more generous and nicer tonight, maybe they get their franchise record 14th in a row in season. I'm just saying. So, I believe in the power of that. All right. Dan, we appreciate your story and the determination and hope that you can do. That was absolutely powerful to see you go basically across the nation, or a good chunk of the nation and Canada as well, to see you do that. Nights like this are special because they unite people from all walks of life who might otherwise never cross paths, but who share a common goal of making pancreatic cancer is something that we can fight, that we can overcome, and you share a common goal of making it a manageable, survivable disease. And while we're talking about what makes nights like this possible, I'd like to recognize the incredible staff members who keep this foundation moving forward. Please stand up when I call your name, and I'll ask the audience to please hold your applause until the end, so that way we can get through this, all right? So, Miranda Wainberg, Director of Patient Programs, stand up. Teresa Valentino, Senior Director of Development. Christine Wells, 3-year survivor, accounting. Matt McLean, 4-year survivor, database manager. Shelley Wyman, 12-year survivor, grant writer. Julia Brabant, warrior story writer. Alina Hicks, events coordinator. Lisa Rudin and Bob Turton and their team of videographers. Nicole, Debbie, Lori, and the rest of the team at Integra Productions. Lisa Thorstensen and the team at the K. Allen Marketing Group. Crystal Henke, as well as Jared Stewart of Stir PR. Helen and Gary Nicely of Logistics. RepView Digital Media and Marketing. Our Pancreatic SOS virtual meetings moderators. They are Perry Francis, Jennifer Sadler, Cindy Paul, and Aaron Thomas. Our Pancreatic Cancer Support for Survivorship hosts and survivors who generously volunteer their time and energy to support others on their journey with this disease. We have Steve Merlin, a 13-year survivor. Kay Kays, a 31-year survivor. Patrick Thoreau, MD, 7-year survivor. Michael Francis, 6-year survivor. Sean Kelman, 7-year caregiver. Mark Rug, 2-year survivor. Teresa Stern-Valtanick, 18-year survivor. Please give them a round of applause. Absolutely awesome, awesome stuff. We're also proud to introduce the members of the Foundation's Board of Directors. If you will stand as I call your name, and we'll applaud for them at the end as well. Roger Magowitz, Liz Macbeth, Don Jenkins, Michael Francis, Pat Schuler, Tom Laporte, Charlotte Pollock, Gary Fazio, Tim Jones, Liz Macbeth, COO, and of course, Roger Magowitz, as I mentioned, the founder of this fine foundation and organization. Please give them a round of applause for this evening. Also, no mention of the Sina Magowitz Foundation team would be complete without honoring someone we lost late last year, Tony Subia. Tony was the true heart and soul of the Sina Magowitz Foundation, poured his heart into its mission for many years. Tony's absence is felt every day, but so too is his legacy, which lives on through the progress he made, the lives he touched, and the hope he gave to the people and families facing this disease. A polite round of applause for the memory of Tony. We have some incredible doctors, researchers, patients set to take the stage here this evening in a few minutes. And trust me when I say their efforts are nothing short of inspiring. They humanize this disease in a way that numbers never can. And they also remind us of why we're here, to stand and fight alongside them and drive forward the progress people with pancreatic cancer so desperately deserve. And for those of you awaiting our raffle, we do have some exciting items up for grabs this year. Stay tuned for our live auction later. Trust me, it was one of the highlights of last year. It's high energy. You want to bid early. You want to bid often. You want to make sure you get these items. They are absolutely incredible. We have, you have, I should say, the chance to score sports tickets, baseball suites, amazing vacations, and so much more. Raffle items will be available for pickup at the registration table as you exit upstairs, and a board listing all of the winners will be on display near the exit. The raffle closes in 15 minutes after the dinner, and so be sure to get those entries in before then. If you have any questions, look to one of our volunteers holding a sign, and they, of course, will be happy to help. Next, we'd like to welcome Dr. Irkut Borzanzi, and I said that right. I did say that right, all right? One of the oldest tricks in broadcasting is if you say something quickly with confidence, everybody assumes you're saying it right. That is a trick, but this is no trick. I said it right, but most of us know him as Dr. B, and he's a good sport about it. He is the Director of Oncology at the Honor Health Research Institute. He holds an appointment as Research Professor at the School of Medicine and Advanced Medical Engineering at Arizona State University. Dr. B has been a principal investigator for several clinical trials. His work has been published in Nature, JAMA Oncology, Clinical Cancer Research, and The Oncologist, among other highly respected journals and publications. Dr. B is excited about the work being done in collaboration with Dr. Evans and the Medical College of Wisconsin, and he will share some exciting developments in pancreatic cancer research that the Sina Magowitz Foundation is supporting. You heard about what Dr. Hall said earlier tonight. Dr. B also has some incredible achievements as well. So Dr. B, join us on stage. Come on up. Thank you very much.
Good evening, everyone. Fairly close. So I'm Dr. Irkut Borzanzi, and as always a pleasure to see so many of you this evening as we take a pause and recognize where we are at in pancreas cancer research and the amazing progress we've made. So I do want to talk about how we're getting closer to that target. We've heard some talks this morning. Even Dr. Hall had recognized the horizon that we're seeing. I want to talk to you about that tonight. First of all, we all know this is a tough disease, but we can't do that without the supports. And all of you out tonight and the amazing work that the Sina Magowitz Foundation has done, getting people together, connected, talking to each other, whether you're a caregiver, whether you're a patient who just got diagnosed with this cancer, whether you've been a 7, 10, 20, 30-year survivor, it's great to get these people coming together and talking about their own experience. So what is that target? It's KRAS. So many of you have heard about KRAS and are very well aware of KRAS. And it's mutated in over 90% of individuals with pancreas cancer. In the past, mentors like my mentor, Dan Von Hoff, and so many researchers around the world have not been able to successfully target KRAS. And the challenge has been, it's so hard to target both directly and indirectly. But there's been some progress made in the last 5 years. One of those progress involves an agent that targets the RAS-on form of KRAS. And this is a drug that's now called daraxonrasib. And the way I liken this, on this picture, what you're seeing is, in yellow, that molecule that binds to the on state of KRAS and then binds to something in the cytoplasm that makes the molecule inert. And so it's like the sandwich that you get with an ice cream sandwich. You got the graham cracker, you got the ice cream and the graham cracker right there, all coming together. And the good news with this helps slow down the growth and activity of pancreas cancer, along with other cancers. This has been shown and presented throughout the year last year. This is a study looking at individuals with stage 4 pancreas cancer who had progressed on chemotherapy and showing a progression-free survival of 8 months. Compare that to traditional chemotherapeutics, where the progression-free survival in second-line pancreas cancer is between 2 to 3.5 months. The other picture at the bottom shows a waterfall plot where the cancer size decreasing in response to this intervention. And as you can see, most of these plots are showing below that y-axis. You see this decrease in most individuals with stage 4 pancreas cancer measured by their scans. The response rate, too, is also encouraging despite the fact they've already progressed on chemotherapy. Well, we also know that there are many isoforms of pancreas cancer. We know that there's G12D, that's the most common one, but so is G12V, G13, Q61, and others. But despite this variety, we know that we can now target these mutations. And here's another waterfall plot of another targeted agents against KRAS with individuals with stage 4 pancreas cancer. And we see that they're all shrinking, mostly shrinking in 2/3 of the patients. So the next question is, what's next? So this is great data. This phase 1 work transitioned to a phase 3 study. This is in second-line stage 4 pancreas cancer. And you'll be hearing about this, I'm pretty optimistic, in the coming months ahead as that data gets resulted and then the FDA considers that data, which I am very hopeful will lead to the approval of this therapy. They're now looking at combinations of KRAS inhibition in the clinic as well with chemotherapy and other antibodies. We have one of those in Honor Health, along with several centers around the country. What's also exciting is we don't really think about immunotherapy too much. We talked about immune therapy and immune treatment and how difficult it is with pancreas cancer. And we know that targeting KRAS successfully in animal models with pancreas cancer allows the immune therapy to work much better. And so we're seeing here at the bottom right of this graph responses where these animal models survive with pancreas cancer. Just this week, 2 other studies have been published in Cancer Discovery showing the utility of targeting KRAS with combination immunotherapy. And we certainly hope to translate this into the clinic soon. This to me is an amazing picture. These are all the KRAS inhibitors in development. So this was really led by the work that was done out of UCSF, Kevin Shokat, who discovered targeting KRAS G12C, and those are already approved in the clinic. KRAS G12C is mostly in lung cancer, but look at all these other KRAS inhibitors. They're targeting KRAS G12D and pan-KRAS inhibitors. There's too many to list, and there's a lot of work being done for the next generation of these inhibitors. So what we're doing at Honor Health is looking at other ways to take those focus inhibitors in combination with various therapies. My colleagues Sunil Sharma and Rafaela Soldi have a system where they can take tumors from the individual, grow them in the lab, sequence them, and allow that sequencing to explore various ways of treatments of these tumors. And what we're seeing here is an individual with pancreas cancer who has been refractory to all lines of chemotherapy. And what we're seeing is that the sensitivity of the KRAS inhibitor in combination with a targeted therapy that targets mTOR. And in blue to green is showing that additive to synergistic effects of these 2 drugs together working better. We also see effective combinations with chemotherapy agents that these cancers already progressed on before. And we also see other various targeted agents that seem to work together with these KRAS inhibitors. So what we intend to do is to plan to go after these various combinations in the clinic. So we're really excited about this. We're also excited about KRAS as far as vaccine therapy. Many of you had brought this up this morning. This is one example of something that's coming into the clinic. This is from a small company called Alicio, and they have a KRAS vaccine. At the time of this publication last year in Nature Medicine, they showed a successful construct targeting KRAS G12D and G12R. And what they also do can stimulate the immune system by targeting the CBG islands in DNA. And what they did in this small phase 1 study was give it to individuals that had an elevated CN99 or a high cell-free DNA post-surgery and no other therapy. And these individuals that responded to the immune therapy did not have progression with their cancer. Their current vaccine construct now targets 7 different mutations in KRAS, and that study is completed last year. We're waiting those results, and many of you may be aware that they currently have an expanded access program throughout the country utilizing this vaccine for those individuals who have already undergone through surgery. But obviously, there's a lot of excitement to see how this develops in the future, along with other approaches to develop other vaccines against KRAS. One can only imagine the utility of utilizing a KRAS vaccine in early detection of pancreas cancer. Many of you know about your own genetics. There's a family history at play as well. And we always ask, what can we do about that? Thankfully, we're collaborating with different investigators throughout the country, throughout the world, and there's a lot of collaborations and discussions throughout the entire world through cooperative groups such as PROCEED, where we're trying to discover better ways to catch pancreas cancer early. And one can envision an approach of interception and using something like a KRAS vaccine to intervene and to prevent the development of pancreas cancer if we can find that solid biomarker to catch this cancer early. So I want to thank you all for having the opportunity to speak tonight. Thanks to Roger and the Sina Magwitz Foundation for all you do, for all the support and the effort and the collaborations throughout the country and throughout the world that we're bringing together to bring a better hope and future to our patients. And the last thing I do want to say, I do hope that some of you can join us in Phoenix in November for a walk to celebrate and to raise awareness and support for pancreas cancer in Phoenix. The weather should be less than 100 degrees that time. Thank you all tonight for coming.
Dr. B, you can truly do it all. He's a meteorologist in addition to solving pancreatic cancer. I love it. That's good stuff. He guarantees it will be less than 100, so you got to make your way down there. We thank Dr. B for his insights, spotlighting some of the breakthroughs currently taking place in pancreatic care and research. And now we'd like to welcome Dr. Doug Evans, the Donald C. Ausman Family Foundation Professor of Surgery, the Chair of the Department of Surgery in the Medical College of Wisconsin, and the Honorary Chair of this year's Power of Us event. Dr. Evans is renowned for his expertise in performing complex surgeries and for his compassionate care towards patients facing daunting diagnoses. He has earned a reputation for treating patients whose disease has been considered inoperable by others, demonstrating both his technical skill and unwavering commitment to improving outcomes for his patients. Dr. Evans and the members of the Le Mans Pancreatic Cancer Program team are leaders in research. They're driving forward groundbreaking advancements in pancreatic cancer treatment. Tonight, we have the incredible opportunity to support Dr. Evans and his team at MCW as they embark on a new clinical trial. The net proceeds raised here will help fund this vital research, the research and clinical trials right here in Milwaukee. And I can't stress that enough. People wonder, hey, where is it at? Where's the money going? Whatever. Right here in Milwaukee, in the Medical College of Wisconsin, make a profound impact on the lives of many around the world. So Milwaukee is on the cutting edge and the leadership of things that are happening internationally. All right, please give me or join me in giving a warm welcome, and please welcome Dr. Doug Evans to the stage. Dr. Evans, come on up.
I was an engineer. I'm an electrical engineer. I worked at GE Healthcare for 30 years. We spend half the year in Johnson City, and then we spend the summers up in Wisconsin. I have a son that lives in St. Paul, Minnesota, and a daughter and a son-in-law in Philadelphia, Pennsylvania. It was Thanksgiving of 2003, and I felt a pain, a little, I wouldn't even say a pain, it was a discomfort in my stomach. It felt like a gas bubble or a gas cramp. My daughter's a nurse, and after about 2 weeks, I said, I still have that pain in my abdomen. And she said, maybe you should get that checked out. And it turned out that my lipase level was off the charts high. And that normally indicates something's going on with your pancreas. So they did a CT scan. The results were that there was a hypodense area on my pancreas. So then he said, we should get an MRI scan. After I had the scan, he got the results back and he wanted me to come in the office, and I thought that wasn't a good sign. So we went and we met with him, and he said, probably, he didn't know for sure, but he said it's probably cancer. My wife and I, when this all happened, we were hiking and we were praying and we were trying to figure out what to do. I have a friend from Bible study in Milwaukee, and he was an ER doctor at Freighter. So we gave him a call when we were on that hike, and I remember him saying, you need to come to Milwaukee, you need to come to Freighter and see Dr. Evans and Dr. George. They're the best there is. We headed back to Milwaukee, and 2 or 3 days later, they had the biopsy scheduled already. The PET scan showed that the cancer had spread to my liver and my lymph nodes, so it was stage 4 pancreatic cancer. Surgery was no longer an option. So then I met more with Dr. George, and he started me on a regimen of chemo. After 2 months of the chemo, they did a scan, and the scan showed that the tumor had actually shrank significantly. After the full 4 months, Dr. George, I remember him telling me he didn't think there was any cancer there at all. He said, it looks like there's something there. He said he thought it was all just scar tissue. And I remember Dr. Evans, he said, you're in uncharted territory. I think we can look at doing radiation and surgery again. I had surgery in September of 2024. I am so appreciative and thankful for what they've given me. Just a year ago, I didn't think I'd be around much longer. And one of the real blessings was my daughter had a grandson in February, and I was able to be there when he was born. It's been such a blessing to get to know him. And so I can just say thank you for letting me experience that. I know he has plans for me, and one of those plans is telling my story. The Sina Megwitz Foundation has probably changed my journey through Dr. Evans, finding out that I was treatable but not curable, and then later finding out that, through research and through Dr. Evans and through my chemo and Dr. George, that I was curable, and now I'm on surveillance. They gave me my life back, and I wanted to express my gratitude to them and encourage others and do whatever I could to help them. A typical day for me, I like to be out on the lake. This is my happy place. We have a little lake cottage here in Heartland. If there's any wind at all, Lee and I will go out and we'll try to sail. We also like to hike. We plan on doing a Portuguese Camino later this fall, so we're preparing to get some hiking in. As we like to take little walks with walk a mile or two with our dog around the neighborhood and stay active. We have chores to do, yard work to do, but the summer is about being by the lake.
I was born and raised in Hiawatha, Kansas, which is a rural town in northeast Kansas. I showed shorthorn cattle. I had a wonderful childhood, and when I retired, I moved to Broken Arrow, Oklahoma. I started not feeling well, and at that time I thought it was a kidney infection. I went and had my cataract surgery on my right eye, and I came home from that and I just didn't feel well. I was diagnosed with stage 3 pancreatic cancer. I went in for a week and they did testing on me. The surgeon down here told me that what I had was a cancer that was in the head of my pancreas. He could not do surgery on me. And so he told me then that there's a surgeon in Milwaukee, Dr. Douglas Evans, and he can do vein reconstruction. My son lives in Milwaukee and he made a call, and at that point, they told me that if I could be there on Monday, he would see me. At first, I thought because all of my relatives, and including my husband, died with cancer, that their outcome was not good. But my son encouraged me that we got to take the next step. And if there's somebody we can see, especially if he's in the city that I'm at and you can come live with me, then we need to at least get more information. Dr. Evans told me that I had a 25% chance of being able to have the surgery. So I had 9 sessions of the chemo, and then after that was complete and I had tests again and it showed again that my tumor was stable and shrunk a little bit. So then they gave me a month to rest, and that was about at Christmas time. Then my radiation started in January, and I did 5 days a week for 6 weeks. And then they gave me another little break. I came back to Broken Arrow for a little bit so I could see my home. And this is where I get strength, from my home. I did have a Whipple surgery on March the 10th. My medical team were very involved in my recovery. They encouraged me, and sometimes I thought, oh, they're just giving me a line to boost me. But they always said that, no, we mean it. Thanks to them, I am alive, and I'm able to tell my story. I've always been an optimist. Even as a child, I always was optimistic. So I had a goal. I had my granddaughter graduated from college in May. So I kind of set a goal that if, they were worried I wouldn't make it to my birthday, my 70th birthday in October, but I did. The best advice I could give to someone who just received the news that they have pancreatic cancer is to get all your information and to take steps to find the right people to take care of your pancreatic cancer. I found the Sina Magowitz Foundation through my surgeon here in Tulsa. So they provide information of actual events of people going through it. That's why it's important. I traveled 638 miles to get to Wisconsin from Broken Arrow, Oklahoma, and I'm so glad I'm here. I had somebody at church ask me, now that you've got a second chance, what are you going to do with it? And I think what I'd really like to try to do is volunteer more. 3 of my favorite things are the elderly, which now I'm an elderly, I guess, young children, and animals. So I'd like to get involved, once I get my strength back, to get involved in those areas. God isn't done with me yet. I have another purpose, so I'm going to try to do my best to fulfill that, whatever it is. Yes, I had ups and downs during my life. I've lost my parents, both my brothers, my husband. I had a child that I lost, but I have a lot of blessings, so I'm very happy.
Well, two great videos. I'd like to thank Roger and the Sina Magowitz Foundation, along with Jeff and Georgie, for putting those together. Just really incredible. So as usual, Urquhart gives you the science, and I'm going to try to impart maybe a touch of philosophy. I'd like to thank both Rogers, the two Rogers of my life, Roger Magowitz, Roger Kaplinger. Just amazing. None of this would happen without you. Urquhart Berzonski mentioned Dan Von Hoff. Dan is someone that we all aspire to be like. I mean, he's the most amazing physician I think all of us in medicine have ever met. And we really miss having Dan here. But Dan, I know, is with us in spirit, and he still is working till about midnight, 1 a.m., and gets up at 5:30. Just absolutely incredible. So let me see where the clicker is here. Oh, there we go. So I'm going to just leave you with a couple simple messages. First, welcome to Milwaukee. Lance, I hope the Bruins, are they doing a little better right now? And by the way, still 2-1. So for all of you who live in Milwaukee, the TV should only go to channel 58 when you're watching the news. Only channel 58, okay? So this is the Mackinac Bridge. So I went under the Mackinac Bridge. So the Mackinac Bridge, when it was built, was the largest freestanding suspension bridge in the world. It's 5 miles long, was built in the mid-1950s at a cost of around $900 million. It would cost $1 billion to reproduce that today. And it separates Lake Michigan from Lake Huron. And you know, there's something peaceful about night. I mean, I don't know what it is, but even me, who's a pretty simple belly surgeon, tries to think great thoughts at night. And it was Winston Churchill who said, sometimes it is not enough to do our best. We need to do what is required. And you know, I can translate that into medicine. Physicians in the treatment team have a responsibility to treat all patients who need us, not just those we think we can manage. And this will be the challenge of the next decade. We're really at a fascinating time when science is moving faster than our ability to implement that science. And I think everything that Urquhart said will come to fruition in the next 5, 10 years. The question is, will we be able to actually get it to the patient? I mentioned this morning at the patient event. I think the patients need a plan, someone to develop that treatment strategy, someone to carry out the plan. Oftentimes that can be your local oncologist, and someone, most importantly, to take care of you. In many of our videos, we emphasize the importance of a quarterback, just so important. So that's message number one. Message number two is the team that it takes to actually implement the plan and to advance science. This is our team here in Milwaukee. We're very lucky to have an endowed program. Marianne and Charles LeBon, Charles goes by Pete, Marianne and Pete have endowed the program, for which we're ever grateful. So I love this phrase, aim small, miss small. So you remember The Patriot, and then of course Bradley Cooper in American Sniper, right? Two just great movies. And you probably wonder, what's this mean? You probably saw this in the movies. Now, the great thinkers, I know Jen probably knows what this means, but the great thinkers in the room probably already know this. But the idea, if you zero in on a tiny, small area, even if you miss, you won't miss by much. So the medical team here tonight thinks about pancreas cancer all the time, just all the time. Even if a cure eludes us, therefore, a difference will be made, without question. And I'd like to spend my allotted next maybe 7 minutes And I'm going to try to, this is going to be like maybe Monday Night Football at halftime. Who's that does that, the fastest 6 minutes? Chris Berman. Okay, thanks, Lynn. So this is my Chris Berman imitation. So I'm going to just go around to a few tables of those people who were involved in the treatment. So as you can see, I'm going to start with table 5, and that's symboled by the owl. So these are where the wisdom, great knowledge lies. So we have Susan Tsai and Andy Gunderson, who came from Ohio State. Can you guys just give a little, raise your hands, tell us where that table is, table 5. So table 5 right over here. Jen Ye, who is an amazingly talented physician scientist. Mohammed Al-Qadek, who works in our pancreas program. Lauren Newell, many of you know Lauren. She and Dave So run the high-risk clinic. Annie Nichols, who's here for Susan, one of the many patients who's disappointed to see me since Dr. Tsai left Milwaukee. Tommy McFall, who I think many of you saw his laboratory this morning, really an expert in the KRAS that Urka talked about. And Melissa Mina, who runs our pancreas program along with Jeremy. Melissa, make sure Jeremy behaves himself tonight, okay? We have a little echo here, so this is, table 6, that's really a serpent. The serpent is meant to symbol healing. Of course, I also put it there because I think I've only been to Arizona once, and it's where all the snakes live, I think. Actually, the only time I've been to Arizona was at a fundraiser, and I sat next to Bob Uecker. And Judy, I could tell the story, but it's somewhere between R and X-rated, so I would have to tell it a bit later, but it is perhaps the greatest one. The greatest story. But anyway, Urquhart is here, and like many great men, we found out last night at dinner that Urquhart, you definitely married up. Where is table 6? There you go, right there. So thank God Amy is there to take care of you. Table 8. So where's table 8? There's table 8. So you're probably wondering, what is a rat doing for table 8? So we learned last night from Nikki that rats are actually one of the nicest animals. Incredibly intelligent. Now, did anyone know this? Incredibly intelligent. They have a deep sense of family, care for each other. I mean, so wherever Nikki was sitting, that table had to be the rat table. There was just no question. Now, we study mice in pancreas cancer. So the mice are mean, nasty, and disposable, but not the rats, right? Okay, so there we have Dave and Suzanne So. I think many of you heard from Dave this morning. We're so thrilled that Dave could join us. Mandana Kamgar in medical oncology. Karen Kirsting is our psychologist for the pancreas program. Now, Karen, in truth, Karen spends about 90% of her time counseling those of us in surgical oncology, and about 10% of your time with patients, right? Probably, yeah. Nikki is there, and Nikki's there with her significant other, Jim. I want you to know, Jim, you were thrown under the bus a little bit last night, but that's okay. Nikki has a hard job. She has a hard job in the laboratory. Venue Pilicetti, Venue visiting us from the University of Washington. A huge impact on Dave So's career and a wonderfully talented physician scientist. Anchi Schaefer, a scientist at MCW who's going to convert her entire laboratory to pancreas cancer, right? We need a nod. We just need a nod there. Oh, okay, that's good. And then Kim and Mike Harris, who are revolutionizing clinical trials. Thank you all so much. Here at table 10, really, what can I say about table 10? Judy, missed you over the past few weeks. Judy Uecker, along with Bob and Kathy and Sue, thank you so much for being here, really. Roger and Jackie, and as all of you heard, Bill and Jane Hall, and we're very fortunate to have 2 endowed chairs for pancreatic cancer research at MCW. the Euchre chair and the Lee chair, and I'll mention Joel and Arlene in a minute. But I'm not sure there is another program in the country that has the program endowed and has 2 endowed chairs to study this disease. And just another example of how we're aiming small, and if we aim small, we're going to miss small. And then Jason and Tricia Crace. Tricia is probably not going to speak to me because we end up having her to come all of these events. Just joking, Tricia. Yeah. As Lance mentioned, a shout out to Tyler Barnes at Table 12. Tyler, where are you? Thank you so much for being here. The Brewers are incredible supporters of the Department of Surgery, the Medical College of Wisconsin. I mean, I don't think there's another city that gets this level of support from an professional athletic organization. It is really amazing, and it means so much. I can tell you that the nurses, absolutely. I can tell you that the nurses on the surgical oncology floor really don't really think that much that I'm maybe there all the time taking care of patients. But the fact that Bob Euchre called me Doug is where I get all my credibility. And that is just so important, so important. I wanted to make a quick trip to table 15. Where's table 15? Natalie. I wanted to say hi to Natalie Sabka. Where is Natalie? There's Natalie. Came all the way here from Trinidad and Tobago. Natalie's husband, John, passed from pancreas cancer, and the John Sabka Foundation is powerful in Trinidad and Tobago. I visited there a couple times. The first time when I was there, I had a bad cold. I'll never forget this, and I was slated to give a talk. And fortunately, Natalie's mother took care of me. So that's the good news, that there was someone who actually took care of me like that. So she gave me the Trinidad and Tobago potion. I just didn't realize that it was largely made of rum. So the good news is when it came time to give my talk, I could speak. I just wasn't making any sense. Yeah. And also, Michael and Cindy Adams, whose video played, was it last year or the year before? It was last year. Really, really fantastic. And then in table 23, I have the duck. And so that's because Beth Erickson is there. Where's Beth? Beth, where are you? There. Yeah, Beth, for some reason you're relegated to the end over there. We'll fix that. So Beth is there with her husband David, and is it your son David? Your son David. Tom isn't here. So I put the duck because the duck always has grace under pressure. You know, everyone is trying to eat the duck, right? And the duck always looks so calm, tremendous grace under pressure, and that is absolutely Dr. Erickson. Where am I? Table 26. So table 26 is symboled by the golden retriever, support and friendship. And Jason, that's your whole team in table 26, okay? Liz, Becky, Michael and Rachel, thank you for joining that crazy group down there. Craig Edelman, Craig, thanks for your support. Ashley Bruner is there. Jerry King, who directs the We Care Fund. We could spend an hour talking about the We Care Fund. And then Joel and Arlene Lee. Joel and Arlene have endowed the other chair for pancreatic cancer research, which is held by Dr. Gwen Lomberg. Really amazing. So, table 27. Where's table 27? They're a little quiet. Come on, table 27. So why do you think I have the lion there? So table 27 is the operating room. The lion is courage, power, leadership. They certainly boss me around all the time. So Eva Bishop, I think many of you have seen Eva and Katie Shesta on the video. Have you seen the video in YouTube, Pancreas School? Hope so. Rachel Budithi and Olga Kaslow, two of the amazing anesthesiologists. Brittany Whirl, who tries to keep everyone in check there, Brittany. David Bishop, Eva's husband, is just there to pay the bill, I think. And Katie's parents are there as well. I want to specifically mention Kathleen Christians. Kathleen, my incredibly cherished longtime partner. I'm a little nervous, Kathleen, about you climbing all these mountains and doing all this crazy stuff. I mean, I'm counting on you to operate on me. So take care of yourself at least until the surgery is done, okay? So that's a lion table. So we're down to table 28, the raccoon. Okay, this is the outpatient cancer center. Where's table 28? Where are you? There's table 28. Yeah, fortunately, Jess prevented me from going into the women's restroom. Thank you, Jess. I was trying to look at my notes there and just got a little confused. I think it was a Seinfeld episode, probably. So the raccoon is resourceful, adaptive, can basically get anything done. And for those of you who've been to the cancer center, right, you know that that's the truth. I think that we start as early as we need to, and we finish when the last patient is seen. There's nothing I'm more proud of. Please know how grateful I am. So in addition to Jess, who I embarrassed there, I think Haley is there, Katie. Many of you who have talked to Natalie and Gabby. Paige just came back from maternity leave. Paige, I want you to know the first day back, I didn't see you cry once, Paige. That was amazing. And Grace Westerman. Grace, I need a yes on transferring to Team Pancreas for tomorrow's bike ride. Now, come on. We need a yes here. And then Dan and Wendy Bears. Wendy, needless to say, thank you for everything. So anyway, that's my whirlwind. I didn't do it quite as fast as Chris Berman, but hopefully you enjoyed meeting everyone who makes everything happen in this great city. So I'll leave you with Kenny Chesney for my favorite quote. Thank you all for being here, and love you all so much.
Thank you, Dr. Evans, for your tireless work. Absolutely appreciate it. I also thank you for the promo of only watching Channel 58. So thank you. I appreciate it. I'm sure my bosses appreciate that too. All right. We'd like to thank Dr. Evans and his team for their groundbreaking work, their relentless dedication to patients facing the toughest diagnosis, and your commitment to improving pancreatic cancer care. It's an inspiration to all of us here. And now please join me in welcoming another person who is a first-year speaker, a 9-year survivor. He is Stephen Bigelson, medical doctor. In 2016, Dr. Bigelson faced a stage 4 pancreatic cancer diagnosis and a prognosis that offered little hope, something that no one wants to hear, okay? A physician himself, he combined science-backed experimental treatments with the more traditional standard of care, and now, about 9 years later, he stands here not just as a survivor, but a valued friend of the foundation. He's also recently written an ebook, Determining the Right Time and Approach for Experimental Treatments, which will be extraordinary new research for patients. To check it out, once again, you can scan the QR code on the business card placed on your table, and it'll take you right to it. So please join me in welcoming Dr. Stephen Bigelson. Impressive story. Thank you, Dr. Stephen.
Hello. Yes, when I was diagnosed with stage 4 pancreatic cancer 9 years ago, I just assumed that I was dying. And I had heard that chemo might extend my life maybe by a few months, but I did not want to drag out the process of dying. I wanted to take a shot, even if it was a long shot, even if it was something really far-fetched. I wanted to try something that might save my life. Now, being a physician, I've spent my career advising people against crazy alternative treatments. So now that I was desperate, I had to figure out the most logical, science-based way to make my plan. I don't know if it was luck or all the people praying for me, but something worked and I survived. So now I've embarked on a project in conjunction with the Sina Magowitz Foundation to assist people who want to take a shot, just like I did, in something experimental, but to do it in the most scientific, logical, and evidence-based manner possible. Even throwing a Hail Mary has to be a better chance of working if it's a well-thought-out and well-planned design. And for people who are in a less desperate situation, there are less risky and sometimes even very safe treatments that, while only experimental, might increase the odds of survival. I've recently received an experimental cancer vaccine in hopes of preventing another recurrence. Now, maybe it'll work, maybe it won't, but it's a very low-risk procedure, and therefore I felt it was logical to go ahead and try. Now, my story's on the internet, and a lot of people contact me. Here's an example of just one situation that comes up a lot. Imagine a loved one diagnosed with a horrible cancer, not wanting to waste time, immediately starts chemotherapy, and then decides to look for experimental treatment. Unfortunately, this is a mistake. It's best to make your plan before you start treatment, because that's when the best clinical trials are available. Once chemotherapy is started, the next opportunity for a clinical trial is after the chemo becomes resistant and stops working, at which time valuable time is lost. Now, whenever possible, clinical trials are always the best way to experiment, as these are designed by people with the most knowledge. And trials designed by my friends here are especially designed to give people the best shot at survival. But when trials are not available, like the example I mentioned, most physicians are reluctant to help, even though there are still things that can be done. Unfortunately, most patients in this situation fall into the hands of quacks and charlatans, trying sometimes, even sometimes very expensive things that have no chance at all helping. This is the situation that we're trying to avoid. And this is the situation we're working to help patients and their families properly navigate. For that reason, we put together an ebook, which you can find on the QR code on your table, or through the Sina Magowitz's website, to advise people on the best way to go through the process. It will be updated as more information comes in, and for that reason, I would really like to hear from all the practitioners here who may have additional suggestions. I'm especially interested how you handle people in this type of situation. People who are asking about things like maybe supplements, repurposed drugs, or maybe people who want to try a trial medication that they don't qualify through the FDA's expanded practice program. Maybe they want to try one of those KRAS inhibitors, but they don't qualify for a trial. There are ways through the FDA sometimes of obtaining these medicines if you tried. So I'd like to hear your thoughts and anybody's thoughts. Go ahead and read the book and then contact me with your suggestions. There's a lot of good information out there, and we'd like to put it all in one place. So lastly, I encourage everybody here, patients, caregivers, practitioners, to visit the Sina Magowitz website, not only for my information, but for much, much more. Thank you.
Thank you, Dr. Steven, and you are the good luck charm. The Brewers tied it up in the top of the ninth, 2-2, so there you go. Miraculous Milwaukee Brewers. Miraculous things happening here tonight as well. By now, some of you might have had the pleasure of meeting our next speaker, Mark Rug. an almost 2-year survivor of neuroendocrine carcinoma, a rare form of the disease that affects only a small fraction of patients. Mark is living proof what can happen when you refuse to take the first or even the fourth or the fifth option. As I like to say, sometimes stubbornness is a good thing. Everybody looks at it negatively. Sometimes if you say, no, that's not the answer I want, and yes, I'm going to do this, and be stubborn, it can succeed. Mark, who works in Hollywood as a child wrangler, I needed you earlier in life, Mark, when I had 3 little ones, although now when they're 22, 19, and 19 with twins, I need a child wrangler, so I need to talk to you about that. He does that on commercial sets. He has a lot of life left ahead of him, and when his doctors told him his condition was inoperable and incurable, he wasn't about to sit back and just accept it. He wasn't also about to abandon the career he loves, the kids he mentors, or the life he's built with his incredible wife, Buffy. Instead, he did what survivors do. He fought. He also sought answers and enlisted his family and loved ones to do the same, and that's how he got in touch with Roger Magowitz and found a support system that not only just a cause, but rather a life well worth saving. Tonight, Mark joins us not just as a survivor, but as a living, breathing reminder of the power of persistence. He also has a heck of a story to tell, so without further ado, please welcome Mark Ruge to the stage. Mark, come on up.
Hello. I have to say, I'm a little embarrassed. I mean, everybody got their wonderful headshot, and I get a picture of my feet. But I think I know why they put that picture up there. Because I was in my chemo chair wearing those socks that said, in this family, nobody fights alone. And that's exactly how I feel about the Sena Magowitz family. No one fights alone here. And I hope you feel the exact same way. So from the bottom of my heart, before I even get started, I need to say thank you to Roger and the entire Sena Magowitz team. I love you, and I thank you, and I look forward to continue to working with you. So, it was funny. I'm almost 2 years, and I came here last year, and I was pretty much a deer in headlights. I was kind of just taking it all in, and I was a little shocked when Roger asked me this year to give a speech, to talk, but I was honored, and I said, of course, Roger. How long you want me to talk for? 15, 20 minutes? He's like, how about 5? So here's my best attempt at short and sweet. But you know, before I begin, I want to say that I really wrote this for the newly diagnosed, because I still remember that gut punch of that diagnosis day. How scared I was, how confused I was. And when I came here last year, I was kind of searching for that common thread. There was so many survivors, and I was like, what can I adopt from all of these survivors that I can take home and use for myself? And I think that was belief. Almost everybody that I talked to had a belief that they could and they would survive. Now I think it's one of the most important ingredients in the whole healing recipe. Now I'm not saying that everybody who believes will heal, but I can almost guarantee if you don't, you won't. Now, I'm a little different than a lot of you, probably most of you, as you heard. My pancreatic cancer is a neuroendocrine carcinoma, not a neuroendocrine tumor, an NET that Steve Jobs made popular. Mine is a neuroendocrine carcinoma. It's even more rare. It's highly aggressive. And my doctors pretty much gave me 4 to 6 months. And I remember this one night. It was very early on, and I thought I better teach my wife, Buffy, how to do our QuickBooks. We have a small production company in Los Angeles, and I've always been the one doing our books. And if I wasn't going to be around, well, she needed to learn. So I got out my laptop, and I proceeded to teach her. Now, I don't know about you and your spouse, but we've never been that good at teaching one another how to do anything. But I was going to try. So I'm like, babe, here's our list of clients, and here's our outstanding invoices. And she's like, so everything's over here. I go, well, until they're paid, and then I put them over there. Well, why do you put them over there? Couldn't you keep them over here? Well, if I kept them over here, I wouldn't see them over there. And this went on and on and on until finally I just slammed the laptop shut. I said, this is insane. By doing this, we're expecting me to die. If I do, then so be it. You'll have to figure it out by yourself. But until then, let's act as if I'm going to live. And you know, right then, the mood changed. Because it was the first time since this whole thing began that our mindset started to shift. It went from believing I was going to die to the possibility that I could live. And the fact that went on and that I could live through this was amazing. I got chemo brain. I got kind of lost in there with the applause. I wasn't expecting it. But sorry. It's all good. I'm just gonna improvise here, because I was talking about that we needed that will to live. Now I'm getting a little confused. I'm gonna just stop for 2 seconds and try to find where I'm at. You know, because that little shift changed everything. Because we realized that healing doesn't start in the body. It starts in the mind. And nothing proves that more powerfully than the placebo effect, which I'm sure most of you here have heard of and understand, where through belief alone, with no added drugs, creates real measurable healing. It's one of the most documented phenomenons in medicine and science. And it's not there to disprove medicine. It's there to prove that belief is medicine. But for belief to become medicine, it has to be unshakable. And that only happens through three kinds of reinforcement. You have to feel it, emotional. You have to live it, experiential. And you have to know it, logical. But let's be real. How the hell are you supposed to do that when everyone around you, including your own doctor sometimes, is telling you something different? You have to change the input. A belief is just a thought that you think over and over again. So you want to change that belief, you have to change that thought. I know when you wake up, you're in pain. But what if you started to label that strength instead? And I know when you go to bed, you feel sick. But what if you started to say you were healing instead? You can create a mantra, a set of words, a phrase that you say over and over and over again. I did. I said them every single day. I still do. I am strong. I am powerful. I am healthy. I am healed. And the more I said it, the more I believed it. And that's when my healing truly begun. Because you know the body might be sick, but the mind, it's still strong. So, how do you want to feel? Turn that into an I am statement and say it daily. And little by little, those doubts fade into a belief. Those beliefs transforms into possibilities, and those possibilities can become your reality. Now, belief is just one of the many ingredients I use in my healing recipe, but I'll tell you this, they must be working, because for over a year, there is no detectable cancer in my body. I went from stage 4 pancreatic cancer spread to my lymph nodes and my liver to now no evidence of disease. So as long as I'm alive, until I take my last breath, I am climbing mountains. I am shouting from rooftops this message: healing is possible. And it starts with that one thing, a belief that you can. Oh my gosh, newbies, don't lose the belief. And remember, in this family, no one fights alone. Thank you, everybody. God bless.
Isn't that incredible? Mark, you were told, and this I will distinctly always remember this, 4 to 6 months, a 2-year cancer survivor, and he's got plenty more life to live. So give him a round of applause. That's incredible. Awesome work, brother. By the way, as a person who works in television, you have an awesome head of hair as well. I can appreciate that as well. So I was checking that out. A lot of good product. I like it. All right. Thank you, Mark and Steve, though. Inspirational messages, great stuff, absolutely awesome. It's tough to put into words just how inspiring these stories are. So thank you for your willingness to put a face on it for the disease, as well as being human and personable and a voice to the fight. Let's keep things moving by welcoming back someone who knows more than anyone else what this mission is all about. Please join me in welcoming back Roger Magowitz, who also has a few special guests to thank as well. Roger, come on up.
Thank you for the patience. I know we have a long evening, but you work so hard for the whole year. I know it's hot, but we'll keep this moving as quick as we can. Now, I'd like to welcome someone many of you know well, Kay Kays. Kay is a 31-year survivor who spent decades advocating for patients, raising awareness, and working alongside impactful organizations to help turn the tide on it. She's a regular fixture and a guest speaker at the foundation. And Kay speaks at many special events and continues to use her voice to influence cancer research at the highest levels, from reviewing federal grant proposals to serving on clinical trial committees. Last year, we introduced a new Survivor Spirit Award in honor of Kay, who was the first recipient, and quickly became one of the most meaningful parts of this event. Tonight, Kay returns to present the award to this year's honoree. Helping her do so are 4 physicians, or we'll make it 3, Dr. Erkut Borazansi, Dr. Evans, and Susan Tsai, if you could just please come up to the stage. Together, these brilliant minds represent the power of collaboration, so please give a warm welcome to Kay, Dr. B, Dr. Evans, and Dr. Tsai. It's now my honor to introduce the recipient of the Kay Kays Spirit Award, which recognizes those whose action, advocacy, and dedication are helping make pancreatic cancer a manageable, survivable disease. This year's honoree is more than a brilliant mind, although he's certainly that. He's also a 13-year pancreatic cancer survivor, a medical technologist, and a moderator of several of our foundation support groups. He's the first to answer calls for patients and caregivers seeking information about clinical trials, genetic and genomic testing, and the best way to counter chemotherapy side effects. Lending a listening ear to those facing some of the most difficult moments of their lives. He'll even take time out of his life to drive or fly out and escort patients to their oncology appointments. It's a pleasure to introduce this year's KK's Survivor Spirit Award, Mr. Steve Merlin.
Once again, a round of applause for Steve. Absolutely awesome stuff. We have a special treat for all of you. Bernie Williams spent 16 seasons. Yeah, give him a round of applause. Still looks great. Give him a round of applause. 16 seasons as a center fielder for the Yankees, cementing his place in team history as one of the greats. Outside of the diamond, he's a classically trained guitarist, Latin Grammy nominee, and a new friend of the foundation. Bernie also has a personal stake in improving care and expanding research for pancreatic cancer, as he lost one of his own band members, Don Harris, to the disease several years ago. And even though he's a Yankee, we like you, Bernie, all right? You know, sometimes Yankees around here, a little bit of a bad connotation, but no, I'm just kidding. Please give a round of applause to Bernie as he leads us in the 7th inning stretch. And of course, Roger, you'll have a photo op with Bernie as soon as it's done. But Bernie's going to warm up the guitar, and here we go.
All right, this is awesome. I'd be remiss if I don't say a few words about how my night has gone so far. First of all, I want to take this opportunity to thank the Sina Magowitz Foundation for giving me the opportunity to be here in this great event. You know, as a professional athlete, I get called to and be invited to do many things, from music education to idiopathic pulmonary fibrosis, and a lot of things, you know, come through my plate. But I had this interesting call from Nicole and Greg from the Love Rocks and God's Love Foundation in New York. And they were explaining to me, you know, that they had this event in Milwaukee, that this organization was so important in saving the life of Nicole's mom, Sue, which I had the pleasure and the privilege to have dinner with her tonight. And I was like, you know what, I'm going to give this a little thought, and I'm going to make it because I love you guys. I think the world of you, and let's do it. So when I came here, I had no idea what to expect, frankly so. And I spent the last 5 hours speaking with Roger, of course, doctors, survivors, donors, and all these stories of perseverance. And I have nothing else to say but have this deep sense of admiration and respect and excitement, you know, for knowing, you know, what's going to happen in the future in the research for this devastating disease. So I mean, they actually made it really good. Even though I'm a Yankee, they sat me in this table in between two Yankees fans. So they're going to be duking it out, for Cashman's Yankee suite, later on. But anyways, my connection runs a little bit deeper. As the gentleman said, my music director and longtime friend, Don Harris, passed away from pancreatic cancer a little over a year ago. So without further ado, in his honor and all of you, this is my little rendition of a tune that hopefully you'll recognize. Thank you so much.
Once again, a round of applause for Bernie Williams. Wasn't that incredible? Awesome stuff. Only question I have, Bernie, I know you got your fan group over there. I'm not good at anything. How are you great at two different things? Grammy nominated and a world-class athlete. How about that? Absolutely incredible blessing. Thank you, Bert. Good parent, good parenting. That's awesome. God bless you, Bertie. That was awesome. All right. Now it's time for one of my favorite parts. If you saw it last year, it was one of the highlights of the night. It was absolutely incredible, the live auction. Don't forget to raise the paddles. Every dollar raised tonight goes directly, I can't stress that enough, directly toward pancreatic cancer research, helping fund clinical trials, expand treatment options, pave the way for breakthroughs that can change the face of pancreatic cancer care today. Leading tonight's auction, if you saw her last year, she's high energy. She brings the show every single time. She is awesome, the incredible Jenny Gale, longtime supporter and friend of the foundation. Whether you're bidding for yourself, someone you love, in memory of someone you've lost, know that every paddle raised pushes that amount closer to better treatment options, earlier detection methods, improved outcomes for everyone affected by this disease. So once again, Jenny Gale. Jenny, come on up.
Thank you. Thank you, Lance. I am so honored and proud to be back as your auctioneer here again. My name is Jenny Gale. I'm from Bravo Benefit Auctions, and I brought my family team again. So my son, Alex Gale, is a ringman, so place your bids to him. My brother, Tim Markham, he came all the way from Iowa to help me. Thank you so much. And my dad, you guys, that's him. Thank you, Dad, for coming from Iowa to help me out. Ladies and gentlemen, as you're bidding, I always say this. I want you to remember, it's not what you're bidding on. It's who you're bidding for. So ladies and gentlemen, raise those paddles high for Sina Megawitz Foundation. Every paddle in the air deserves an applause. Ladies and gentlemen, let's have some fun. Grab those paddles. Tim, tell us about the first item.
All right, ladies and gentlemen, get ready for the ultimate outing for your crew. This here is a private luxury suite for the 2026 season for the Arizona Diamondbacks. 18 tickets, food and beverages included. Enjoy the game in style, all thanks to the generous donation from Derek Hall, President and CEO of the Arizona Diamondbacks. Ladies and gentlemen, are you ready for an auction? That was okay. Are you ready for an auction? Let's have some fun. Jenny, take it away.
That's more like it. Get your paddles. The power of us. Who started at $2,000? 2,000. 2 to 2 would get 2 to 2 would get $2,000. 2,000 would get 2 to 2 bid 2 would get 2,000 is bid. Now 4,000. 2,000 is on my right. You got to be 4,000 is bid. Ladies and gentlemen, put your hands together.
Let's go.
$6,000. $6,000. I would get $6,000. Ladies and gentlemen, let's give her some encouragement. $4,000 is bid on the left side. We're asking $6,000. $6,000. Ma'am, would you be 5,000? 5,000. Five's in the back. And now 6,000. 6,000. 6,000. Would it get $6,000 out there? Would it get 6,000? 5,000 is bid. Asking $6,000. 5,000. Would it get 6? Would it get 6? 6,000. Would it get 6,000? 6,000. Now 7. 6,000, asking $7,000. Don't miss this opportunity. 6,000, bid 7. Go 7. Go 7. What it gets? Go ahead. Be 7,000. 6,000, 7,000. 7,000. Would it get 7? Would it get 7? Would it get 7,000 out there? Would it get 7,000? Anybody else? 6. How about 6,500? One time. 6,500 going once. 6,500 is bid. $7,000. That's more like it. 75. 75. 5 would get $500. Now 8,000. 8,000 is bid. Go 9,000. 8,000 would get 9, bid 9 would get 9,000. 9,000 would get 9. 8,500. 8,000 is bid. Asking 8,500. 85 for 5, bid 5 would get 5 for 5 would get $9,000. Sir, go ahead and be 10,000. 10,000. $10,000. $10,000. What do you think? $10,000. Ladies and gentlemen, let's give some encouragement. 8,500 is bid. Would you be $9,000? Anybody else? 85 to 5 bid 5 would get 9,000 going once. $9,000 going twice. Third and final call. Ladies and gentlemen, put your hands together. Sold. $8,500. Thank you so much. Bidder number is number 5656. Thank you so much. Thank you to our backup bidders. That's an amazing start. Tim.
All right, that is amazing. All right, who needs a getaway? Who in here needs a getaway? Here's your opportunity. It's a one-week stay at the Australian Gold in Emerald Island, North Carolina. Get ready for sunshine, sea breezes, and a laid-back luxury with a 6-night, 7-day stay at Australian Gold. Stunning oceanfront retreat in beautiful Emerald Isle, North Carolina. All right, this is donated generously by Kate and Steve Setzer. Jenny, take it away.
All right, and it sleeps 10. What do you think about that? Let's start it out at $2,000. Hands high. 2, 3, 2 to 2. Would it get 4,000? Would it get 6,000? 4 for 4, but 4 would it get $6,000 out there? Would it get 4, 6? 6,000, 6,000. $4,000 is bid. Who would like to be $6,000? 6,000, 6,000. How about 5? 5,000. 5 for 5 and 5 would give 5 for 5 and 5 would give 5,000. 5 for 5 and 5 would give 5 for 5 and 5 would give 5,000 out there would give 5,000. Dad, you have 5,000 is bid. You got to be 6. 6,000. 5,000. $6,000. 6,000. Don't let them steal your vacation away. 5,000, 6,000, 6,000, 6,000 would give 5 for 5 and 5 would give 6,000. Anybody else? 5,000, 6,000. I have 5,000 up front. Up front here. You got to be $6,000. Going once. $6,000. He's 5,500 is bid. Asking $6,000. 6,000. 55, $6,000. 6,000 would it get 6? Would it get 6? 6,000. Would it get 6,000? It's only money, ma'am. 5,500 is bid. Asking $6,000. Going once. 5,500. 6,000 going twice. Third and final call. Thunderous applause, ladies and gentlemen. Sold. $5,500. 192. The buyer. 192. Thank you to our backup bidder.
Our next item, ladies and gentlemen, catch the Yankees in style. 10 premium suite tickets for a 2026 regular season game, courtesy of Brian Cashman, Senior Vice President and General Manager of the New York Yankees. Arrive in VIP fashion with an elevator access to a private suite entrance. How many Yankee fans we got here tonight? Look at the hands go up, all right? In Milwaukee, this is fantastic. Well, this should be easy, right? This should be easy. All right, Jenny, take it away, the Yankees.
All right, here we go. Set it in. Who wants to get in on this one? Who wants to start it at $2,500? 2005, would get 5 for 5 at 5, would get 7,500. 75 for 5 at 5, would get 75, would get 10,000. 10,000 to 10, would get 10 to 10, would get 10,000. 10,000 would get 10 to 10, would get 10, 10,000 there, would get 10,000. 10, 8,000 is bid. Now 9,000. 9,000. 9,000 there would get 9, but 9 would get 9,000. 9,000 is bid. Now $10,000. 10, 10 to 10 would get 10 to 10, but 10. 10 is bid. $11,000. What do you think, Phil? 10,000 is bid. Asking 11. Go ahead. Be 11,000. He says, you bet I will. 12,000. 12,000. There is no friends at an auction. 12,000 is bid. 13,000. 13. 13. 13. Would get 13. Ladies and gentlemen, give him some encouragement.
Let's go.
12,000 is bid. Asking $13,000. 13,000. 13 would get 13. 13,000. Now 14. 14. 14. 15. 15. 15. 15 would get 15. 15 would get $15,000. What do you think? $15,000. 14,000 is bid. 15. 15 would get 15. 15 would get 15. Would get 15. Anybody else? What do you think, sir? $15,000 going once. Thank you so much for what you did do. $15,000 going twice. Third and final call. Ladies and gentlemen, hands together. Sold. $14,000. Bidder number is 5656.
All right, fantastic. Our next item in the lineup. Own a rare and powerful piece of basketball history. An authenticated basketball signed by the late Kobe Bryant, 5-time NBA champion, 2-time Finals MVP, and 18-time All-Star. Perfect thing for your memorabilia collection. Added here tonight, all for a great cause. They're going to be walking it around. It's right there. And this here is donated generously by Martin Weiner, MD. Take it away.
Take it away. Here we go. Started out at $2,000. Let's go. 2,000 to 2. Would it get 2 to 2? Bid 2. Would it get 2,000 is bid. Now $4,000. 4,000. 2,000. $4,000. 2 4 to 2 would get 4 for 4 but 4 would get 4,000. 4,000 would get 4 for 4 but 4 would get 4. 4,000 there would get 4,000. 2,000 is bid. Take a closer look. I have you at 2,000. Asking, how about 3,000? 3,000. 3 but 3 would get 4 would get 4 for 4 but 4 would get 4,000. 3,000 would get 4 for 4 but 4 would get 4. 4,000. 4,000. Now 5,000. 5,000. 4,000 is bid. You got to be $5,000. 5,000. 5 for 5 but 5 would get 5 for 5 but 5 would get 5,000. She says, you bet I'll support. At $5,000. It's your turn. He says, 6,000, you bet. Now 7. Go 7. Would it get 7? Would it get 7? Would it get 7,000? 7,000. Would it get 7? Would it get 7? Would it get 7? 7,000 down there. Would it get 7,000? $7,000. She wants to take a closer look. That's fair. 6,000 is bid. $7,000. 7,000. 7,000. $8,000. 8,000. 8,000. Don't be a quitter, sir. He says, all right, $8,000. $9,000. 9,000. 9,000. 9,000. 8,000 is bid. She's phoning a friend. $9,000. I thought we were friends. 8,000 is bid. Asking 9,000. 9,000. Would you be 8,500? 85. 85, 5, 5. Want to get 5, 8,500. Going once. Oh, she says to wait. We have time. All right. Does anybody want to bid on this side? $8,500. 85, 85, 85, 5, 5, would get 500. $8,500. What do you think? She says, you bet. She just raised her paddle at $8,500. Sir, just be 10,000. 8,500 is bid. What do you want to be? He says 87.50. 9. You can just be 10,000. 8,750 is bid. $9,000. You bet, she said. 9,000. What do you think? 9,500. Ladies and gentlemen, let's give them a big round of applause. 9,500 is bid, asking 10,000. 10. 97.50. $10,000 is bid. 10,000 is bid. 10,500. 11,000. What do you think? 11,000. You said no the last time. 10,500 is bid. Do you want to be 10,750? Sure. $11,000. Go ahead. 11,000. $11,000. Ladies and gentlemen, put your hands together. She said, did she say yes? 11,000 is bid. I think I believe on this time. 11,000. 11,500 would give 500. Anybody else? 11,500 going once. 11,500 going twice. Third and final call. Ladies and gentlemen, put your hands together. Sold. $11,000. All right, our next item, my brother Tim is going to take the microphone. It is a Brewers owner suite experience for the 2026 season. Experience Brewers baseball like a VIP with exclusive access to the owner suite at American Family Field right here during the 2026 regular season, generously donated by Mark Atanasio. Hopefully I said that right. Chairman and principal owner of the Milwaukee Brewers. Enjoy the game in ultimate comfort with 10 tickets for you and your guests, complete with catered food and beverages, and 2 parking passes in a designated lot. Your group will be welcomed with a personalized scoreboard message. Did you hear that? A personalized scoreboard message during the game. Ladies and gentlemen, let's do it. Hands high. Take it away.
All right. And is it a final? The Brewers scored 3 in the top of the 11th, took the lead 6-3. Is it final? Does anybody know? Not yet. All right. Well, let us know. Keep us informed. All right, Brewer fans, how about the best team in baseball? All right, here we go. I'll set them in down here. What do you want to be? Oh, here we go. I'm going to set it down. Let y'all go at $2,000. At $2,000. Now, $3,000. 2,000 has bid. 3,000. 3,000. 4,000. At 4,000. Here we go. $4,000. $4,000 is all. It's It's only money. Go ahead. 4,000. Thank you. Now 5. If 5, and you get 5. Here to 5. $6,000. It's 6,000. 6,000. Now 7,000. It's $7,000. Here to 7,000. 6,000 is bid. 7,000. Give $7,000. Here to 7,000. The more you pay, the more you're going to like them. 7,000. It's 7,000. 6,500. I never thought of it. How about 7,000? 7,000. 65 here. 7,000. Give $7,000 here to 7,000. It's 7,000 as bid. Now 75. It's 75. You started this, sir. 7,500. It's 75. It's 75. $8,000. 8,000. 8,000. 8,000. 8,000. 85. 85. 5 and get 8,500. $8,500 here to 8,500. $8,500 here to 85. 85. 8,000 is bid. Take another drink. Just give me 8,500. 8,500. 85. 85. 5 and get 8,500. Anyone else here to 8,500? I tell you what. What do we have? We have $8,000 over here, right? If we could double this, would you take another one for $8,000 and we can double our money and we could sell 2? Would you like one for the $8,000? I could sell one there and we can double it. I'm going to let you think about it a second. I've got $8,000 over here. Would you want? I'm going to sell the old. I'm going to let you decide first. You want to go to them? Thank you so much for what you've done. Ladies and gentlemen, sell it at $8,000, and I'm going to sell it over here at $8,000. Give them both a big round of applause. Bidder numbers tonight is 56 on the left side, 59, 59 on the right. Thank you. That was awesome. Jenny, what do we get next?
Number 6. It is a private in-home dinner with executive chef Lauren Roux. Treat your guests to an unforgettable culinary evening prepared by Lauren Roux, executive chef at Scarlet Hotel Group. In this exclusive at-home event, Chef Lauren will craft a custom 5-course meal for 6 to 8 guests, tailored to your taste and prepared right in your kitchen. From personalized menu planning to grocery shopping, cooking, and cleanup, every detail is handled. You can sit back, relax, enjoy, and experience a meal without any of the stress of hosting. Guests are invited to watch and even participate as the chef shares his expertise in an interactive demonstration. It's going to take place on a mutually agreed upon date. Wine and alcohol are not included. Ladies and gentlemen, hands high for Sina Magwitz Foundation. Wine pairings can be arranged separately. Donated by Chef Lauren Roux. What an offering here.
You bet. Here we go. I spoke with the person who purchased this last year. They said it was unbelievable. Absolutely amazing, right? All right, here we go. And how much here? Out here, dinner, a private in-home dinner now. Here we go. Down here, let y'all go. $2,000. If $2,000, here $2,000. If $2,000 now, 5. It'll get 5. Here $5,000. If 5,000, I'm 2,000. Let's go. 3. Here $3,000. If $3,000, here $3,000. If $3,000, here 2,000 is bid. 3,000. Get your hands high. Let's go. 3,000. If 3,000. If $3,000. 2,000 is bid. 3,000. If 3,000. Let's go. 2,500. Did you get 25? All right, now let's go. $3,000. If 3,000, 3,000. Don't think, just do it. 3,000. Thank you. 35. If 35, 5, and get 5, hit it about 3,500. If 35, yes, $4,000. If 4,000, if $4,000, hit it about 4,000. 4,000, sir. Thank you. 4,000. Now 45. If 45. If 45. 5. To get 5. Here to get 4,500. If 45. If 45. 5. To get 4. Sir, I sell this stuff all the time. I will tell you when it's too much. 45. Go ahead. Thank you. 5,000. If $5,000. She did it about 5,000. If $5,000. She did it about $5,000. She did it about 5,000. You got to be. Here we go. 5,000. Yes. 55. If 55. If 55. 5. To get 5. Here to get about 55. 5. Here to get about 55. 5,500. Ladies and gentlemen, do you think you should bid 5,500? Let's go. At 55. 52.50. Oh, they're working me over. I'll take your money. 55. I'm 52 and a half. 55. At 55, 5 to get 5 now. 7.5. At 57.50. At 57.50. Here to the 57.50. At 57.50. Here to the 57. And now $6,000. It's 6,000. It's 6,000. Little energy. Let's go. 6,000. It's 6,000. It's $6,000. Here to the $6,000. It's only money. 6,000. It's 6,000. It's 6,000. I'm 57.50 on the right side. $6,000. $6,000. Take your time, but hurry up a little bit. 6,000. It's $6,000. Go once now. It's 6,000. Yes, he did. Now 62.50. It's 62.50. It's 6,000 a bid. Here did it about 62 and a half. It's 62.22. Here did it about 62 and a half. Here did it about 62.50. It's 62.50. It's $6,000 bid. 62.50 going. Yes, now 5. It's 65. It's 65. Here did it about $6,500. It's 65, 5, hit it at about 65, 5, come on, 65. It's 65, it's 65, 5, hit it at about $6,500 going once. Now don't miss it now. It's 65, yes, now 7.5. It's 67.50. 6,500 is bid. 67.50. It's 67.50. That's where we should have started. 67.50. At 65 to bid. 67. At 67, 70 did it about 67. Are we through? At 67. It's 67, 70 did it about 7.5. Did it about 67.50 going once. At 67.50 going twice. Anybody else here did it about 67.50? Thank you so much for what you did, sir. At 67.50, last call, and I have. Put your hands together. I'm going to sell it at $6,500. 310's your winner. 310. Jenny.
All right, ladies and gentlemen, indulge in the ultimate Vegas escape with a luxury stay at the iconic Bellagio Hotel. The winning bidder will receive $5,000 toward room rate, resort fees, and taxes for up to 2 rooms, offering the perfect opportunity to experience the elegance and excitement of the Las Vegas Strip. Whether you're drawn to the world-class dining, renowned fountains, or vibrant nightlife, this Bellagio retreat is your chance to relax, celebrate, and create unforgettable memories in one of the most glamorous destinations in the world. Ladies and gentlemen, Tim, take it away. Who's going to Las Vegas?
Bellagio, Las Vegas. And here we go. How much here? Out here to the set of man down here. Somebody get $5,000. Here we go. If 5, it'll get $5,000. She did it about 5,000. If $5,000, she did it about. I'm gonna let y'all go. $1,000. Hand should be swinging. Let's go. Now 2. Now 2. He did it about 2,000. If $2,000, she did it about 2,000. If 2,000, now 3. Now 3. Down he did it about $3,000. If 3,000, here we go. 3,000. At $3,000, she did it about 3,000. At $3,000, she did it about $3,000 is all. 3,000. At $3,000, she did it about 3,000. At $3,000, she did it about $3,000. At 3,000, she did it about $3,000. She did it about 3,000. My goodness. Jenny, what's going on here? 3,000, at 3,000, at 3,000. It's a steal, ladies and gentlemen. Here we go. 3,000. 2,500. Never thought of it. Now 3,000. At $3,000, she did it about $3,000. At 3,000. Little energy. Let's go. 3,000. At 3,000. At $3,000, she did it about 3,000. At $3,000. My goodness. 3,000. At $3,000. I'm going to sell it. At 3,000. At $3,000. Now going once. And now 35. And now 35. Here we go. 35. At 35. I hit it about 3,500. At 3,500. She did it about 3,500. At 3,500, go ahead. 35. What's to think about? My goodness, 3,500. At 35. At 35. Now 4,000. At $4,000. Down did it about 4,000. At 4,000. At 35 to bid. 4,000. $4,000. What do we think? At 4,000. At $4,000. She did it about $4,000. My goodness, 3,500 is a bid. $4,000. If $4,000, anybody else? You did it about 4,000 going once. $4,000 going twice. Third and final call. Anybody else here to $4,000? And we have. Give him a big round of applause. I'm going to sell it at $3,500. 265. 265.
Next up, enjoy an unforgettable evening of baseball and VIP hospitality at Chase Field with 6 dugout box seats to a 2026 Arizona Diamondbacks regular season home game. Before the first pitch, you and your guests will join Diamondbacks president and CEO Derek Hall and World Series hero Luis Gonzalez for a private pregame dinner at Bourbon and Bones, located inside the ballpark. This exclusive experience offers up-close views of the action, incredible conversation, and an inside look at the game from 2 of the most respected names in baseball. Ladies and gentlemen, generously donated by Derek Hall. Sounds amazing to me, Tim. Go take it away.
Diamondbacks dugout experience. You betcha. Derek Hall and Luis Gonzalez. My goodness, here we go. Ladies and gentlemen, how much hair down here? Set them in. How much here? Somebody get 2,000. Here we go. At 2,000. $2,000. My goodness, hand should be swinging 2,000. If $2,000, you did it. $2,000. At 2,000. Who wants to go first? 2,000. If $2,000, you did it. 2,000. Thank you. I got it in the back there. Now $3,000. At 2 to bid, 3 to buy. He did it about $3,000. He did it about $3,000.
Tim, this is priceless.
It is. It's a priceless experience, and we're all for a great cause here tonight. $3,000. $2,000 in left side. You got to be $3,000. He did it about $3,000. She did it about $3,000. At $3,000 down. He did it about $3,000. Thank you. Now $4,000. At $4,000. $3,000 down front. You got to be $4,000. At $4,000 down. He did it about $4,000. At $4,000. I'll take 35. It doesn't sound like near as much. 3,500. At 35. At 35. You don't want to do it. At 3,500. At 35. He did it about $3,500. She did it about 35. At $3,500 go. What's now? She did it about $3,500. At 35. Don't miss it now. $3,500 going twice. At 3,500. At 35. He did it about 35. 35. Now 4,000. Now 4,000. Now $4,000. At 35 to bid, 4 to buy. He did it about 4,000. At 35, he did it about 4,000. At $4,000. $4,000. My goodness. $4,000. Are we paying attention? 4,000 at 35. I'll do 7.5 before we go. 37.50 at 35. 37.5 going once. He did it about 35. 37.5 going twice. 37.50 last call. And now 4,000. And now $4,000. Here we go. At 4,000. At 4,000. He did it about 4,000. At 4, just take another drink and just give me $4,000. Here we go. 4,000. At 4,000. At 37.5 to bid. 4 to buy. He did it about 4,000. You want to do it? At 4,000. At 4,000 has bid. Now 42.50. And now 42.50. $4,000 down. He did it about 42.50. At 42.50. 4,000. Anybody else? He did it about $4,250. At 42.50 last call, 42.50, and we have. Thank you so much, sir. But I'm going to sell it right here at $4,000. Good job, sir. That bidder number today is 62. 62, and thank you.
This is the final live auction item. It is a Radiance redefined 14-karat white gold and lab diamond tennis bracelet. Drape yourself or a loved one in timeless elegance with this exquisite 14-karat white gold tennis bracelet featuring an extraordinary 17.57 total carats of lab-grown diamonds, meticulously crafted to capture light from every angle. This piece delivers unmatched brilliance and sophistication. Wear it for a special occasion. Elevate your everyday style. This heirloom-worthy bracelet is a stunning expression of luxury and grace. Ladies and gentlemen, get in on this one.
All right, let's finish strong. Lots of energy with this one. The Brewers win 6-5 and 11. All right, here we go. That's 14 in a row, I believe.
This was donated by Harry Glinberg Jewelers. Thank you so much.
All right, let's finish strong, ladies and gentlemen. The bracelet is making its way around. It's right down here in front. All right, here we go down here. Cinnamon, how much hair? Down here. I think I see $25,000 on the board, right? How much hair? Give $5,000. Here we go. If $5,000. If $5,000. 5,000. Yes, now $7,500. If 5,000, 7,500. It's 75. What's that? 75. I got $5,000 on the right side. You get 75. Now just give me 10,000. Here we go. If 10,000. It's $10,000. He did it on 75. He did it on 10,000. It's 75. Give 85. 8,500. It's 75. 85. It's 85. 8,500. It's 75. 85. 85. $8,500. 8,500. My goodness, 85. Yes, 8,500. Now 10,000. And now 10,000. 85 to bid. 10 to buy. He did it on $10,000. And now 10 here. Now give me 12.5, sir. At 12.5. 10,000's on the right side. You got to be 12.5. If 12.5. At 12.5. Ladies and gentlemen, should he bid 12.5? Let's go. Let's hear it. At 12.5. At 12.5. At 12.5. I'm going to get 5 here. Did it on 12.5. Is that 11? $11,000 is bid. And now 12. Here we go. 12. At 12. Yes, 13. 13,000. If $13,000, he did it on 13,000. At 13. Yes, now 14,000. Here we go. Let them hear you. 14,000. Let's go. 15. At 15,000. At 15,000. At $15,000, he did it on 15,000. 15,000. The more you pay, the more you're going to like it now. 15,000. At 14. 15. At 15,000. At $15,000 down to the oh, how can you say no now? 15,000. 15,000. At 50. Yes, he did it. 15. 16. Here we go. 16,000. We got a bit more. Here we go. 16,000. It's $16,000 down to the 16,000. Yes, yes, yes. 17. It's 17. At 16, 17. They are near done. Let's go. 17. It's 17,000. It's $17,000 down to the 17,000. It's 17,000. 16's the bid. 17 to buy it now. It's 17,000. Here we go. It's $17,000. You did it on 17,000. It's $17,000. Come on, some energy. Let's go. 17. It's the last chance. Yes, 18. 18,000. 17 is bid. 18. $18,000. You did it on 18,000. 18. Oh, that was 17.5. 16.5. Is that what you did? Is that what you did? 16. We'll take your money. 16.5. Now 17. It's 17,000. It's $17,000. You did it on 17,000. It's $17,000. You did it on 17. It's 16.5. You did it on 17. It's 17. 17. 17. Hurry up and take your time. You did it on 17. At 16.5. He did it on 17,000. You want to do it? It's $17,000 going once now. It's 17,000. Are we through? It's $17,000 second. Here did it on 17. 16.5. Did it on 17,000. Go crazy, folks. I'm going to sell it at $16,500. 16.5. Your winner is 127. 127.
Lance?
Give a round of applause to Jenny and the Gale family and everybody. Absolutely incredible. Always high energy. They do a great job. All of it going for pancreatic cancer research and awareness. Absolutely great stuff. Thank you for making it a very memorable evening. We know you take time out for this. You spend money on this. And you come here, and maybe it takes you a little bit to get here as well. We are gracious and thankful for all of that and all the sacrifices that you've done tonight. We can't thank you enough for your willingness to come here to Milwaukee, support the Sina Magowitz Foundation, and ultimately change the face and future of pancreatic cancer care in the United States and beyond. For Lance Allen, myself, thank you so much for having me once again. Hopefully I'll be back next year. For Roger and all my friends out there, great stuff. Roger Magowitz, please join us up on stage and close out this amazing evening. Thank you very much. Brewers won, by the way, as you heard, 6-5, so it's a magical night all around. 14 straight wins, franchise record.
Two quick things, humbled by your patience. I just want to tell you about two quick programs that we have, and I'm just going to ask those three people to stand. Because of the outpouring of people wanting a neuroendocrine program, we're going to have a patient support program just for neuroendocrine patients. Mark Rug is going to be one of our hosts. Teresa is going to be one of our hosts. And Aaron is going to be the moderator. And if you guys can just stand, so if anybody needs to come up to you, they'll know exactly where to go. The other project that we're really anxious to pull off is our new Care Kitchen. Care Kitchen by the Sina Magowitz Foundation is a monthly nutrition and cooking series for pancreatic cancer patients led by scientist and chef and foundation supporter Gia Fazio. Gia's father, Gary, has been a prolific foundation advocate since day one, and we're thrilled to see Gia continue Gary's legacy by supporting this program. Gia, would you please stand up? And Michelle Stack is going to be our nutritionist. I know we went over, but Lance will come up to introduce our paddle call real quick, and that will end the evening.
All right, and if you are like some of us, I know my wife and I are like this, we don't need much more in life. Trust me on that. We have enough stuff in our house, but we like to give back willingly, and we like to give back generously. So Jenny's going to take over from here. It's just a simple paddle call. If you feel led to give, if you felt led to give any amount, Jenny will guide us through that, but I always love the appreciation and the generosity of everyone here. So Jenny, take it away.
Thank you, Lance. The next part of our program is the paddle raise. Ladies and gentlemen, we're going to ask you to give at various levels of giving. And if I mention an amount that's meaningful to your heart, we ask you to raise your paddle, to raise it strong, to raise it proud in support of the Sina Magowitz Foundation. Let's show pancreatic cancer the power of us. And when you raise your paddle at that amount, we ask you to keep your paddle in the air until your number is recognized. Every level makes a huge difference. Our first level of support is $20,000. Is there anybody in the room who can help at $20,000? Ladies and gentlemen, bidder number 265 just led the way at 20. Oh, wait, sorry. Yeah. Ladies and gentlemen, not 20,000, $50,000. Bidder number 265 gives $50,000. Ladies and gentlemen, a big round of applause. Thank you for leading the way. Is there anybody else who would like to join in at the $20,000 level or any other level above 20? Ladies and gentlemen, let's give another big round of applause to our $50,000 donors. Our next level of support is $10,000. If you can help at $10,000, we ask you to raise your paddle at this moment. No one fights alone. Anybody at all that can help at $10,000? $10,000? Our next level of support is $5,000. If you can help at the $5,000 level, we ask you to raise your paddle. Raise it proud, raise it strong in support of pancreatic cancer. Anybody at all at $5,000? If you can, now is that moment. Ladies and gentlemen, thank you so much for your $5,000 donation. Do you guys have a paddle? That's right, they'll get your name. Oh, yeah. He says they know me. Ladies and gentlemen, let's give him a round of applause. $5,000. Is there anybody who would like to join him at the $5,000 level? Anybody at all? $5,000. Our next level of support, thank you so much. We appreciate you. Our next level of support and our final level of support here tonight is $1,000. If you can help by raising your paddle for $1,000, we ask you to do it at this point. Bidder number 290, thank you. Bidder number 287, thank you. Thank you for your $1,000 donation. Bidder number 222 says, I'd like to help. Bidder number 139 stands for pancreatic cancer. 269, thank you for your support. Bidder number 199 says, I'd like to help at $1,000. Bidder number 67, thank you for your support at $1,000. Who else? Who else would like to help at $1,000? Look at the paddles. Bidder number 308 says, I'd like to help. Bernie says, he's a fan. Gives $1,000. Thank you, Bernie. Who else would like to help at $1,000? Bidder number 185 gives $1,000. Bidder number 258 raises their paddle at $1,000. Who else would like to join? 133, thank you for your support. The power of us. Anybody else at $1,000? Who can help at $1,000? Anybody else? $1,000. Ladies and gentlemen, let's give our $1,000 donors a round of applause. Thank you so much for filling this room with so much love and generosity. Roger.
Big thank you for everybody's patience. If you want a raffle item, just please head upstairs by the registration. You'll see people waiting for you. Also, there's one lucky winner of the centerpiece. If you look under your chair, you'll see a sticker. Whoever has a sticker under the chair is the lucky winner. Thank you all for coming. Thank you for patience. And thank you for a great Power of Us evening.
Mysterious. We don't have to act so seriously, like nobody's watching, only us. Baby, if it